We're going to go ahead and call the Lake County Board of Supervisors meeting for July 14th to order at 9 a.m. We're going to go as usual with a moment of silence, and Supervisor Brown, I'll go ahead and turn it over to you.
Yeah, thank you. Last week we were remiss in not recognizing and dedicating the moment of silence to someone who's dedicated their whole life to our community and most recently in the efforts of the Westlake Park, Charlie Jolin. It was a huge loss to our community, but he, at 94 years, I think he got his money's worth, so we're really appreciative of the time we had with him.
Okay, Supervisor Brown, would you please lead us in the Pledge of Allegiance?
I will, thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Yeah, I apologize. Number four, any extra items not appearing on the posted agenda today? Do we have any extra items?
Can I ask a quick question, just real quick first, before we begin? Normally when we have the screen on for a video, the lights are off, and I'm just wondering if it's okay with the board and the one other person that's here, if it's okay we can do that. There we go. Is that okay? It's hard to see through the glare of all the safety glass we have here. Thank you.
Okay.
Mr. Chair, can you pause just a moment? I want to make sure Granica's sound is live.
Okay.
Yes, it's live.
Thank you. Go ahead, Mr. Chair.
Okay, moving forward with the agenda here, I'll go ahead with the approval of the consent agenda. Consent agenda items are usually non-controversial and it will be moved through. So I do know we've had some requests to have some items pulled today from the board. I know that was sent in. So are there any items that need to be pulled from the board?
No.
I know we had a request, item 5.11 from the sheriff.
And 5.3, I think.
Yeah, and it's, yep, and item 5.3 by Supervisor Brown. Are there any other items that need to be pulled from the board? Okay, seeing none, we'll go ahead and ask, go ahead and open it up to the room, Jake. Are there any items on the consent agenda that need to be pulled from the public? Jake?
Yeah, so I don't see any raised hands here, so I will unmute the floor.
Okay.
All right, if you would like to make a comment, please start by stating your first and last name.
Okay, Jake, hearing none, we'll go ahead and close the room and bring it back to the board for action.
Mr. Chair,
Got an echo.
is this better? There we go.
Yeah.
Mr. Chair, I move to approve items 5.1 through 5.2 and 5.4 through 5.10 and 5.12 and 5.13.
Okay, is there a second?
Second.
Seconded by Supervisor Crandall. Johanna, can we go ahead and do the roll call vote?
Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Yes.
And Supervisor Simon.
Yes.
Thank you.
Okay, at this time, we're going to go ahead and move right into Dr. Pace's report, and then we'll come back and deal with the pulled items. Well, I'll ask the board. We're going to go ahead and move forward with. We'll get Dr. Pace's report, and then we'll keep Dr. Pace around. I think he'll be here for one of the discussion items. So go ahead, Dr. Pace. We're going to move to I apologize. Lost my agenda here for a second. We're going to go ahead and move to our, I apologize here, our 6.1 item, or 9:01 a.m., or no, our 6.2 item, our 9:02 a.m. item, consideration of an update of COVID-19. So Dr. Pace?
Okay, thank you, Mr. Chair.
Melissa, do you want to listen to Dr. Pace?
We could mute the room there, Jake.
Got it.
Good morning. Thank you, Mr. Chair. Good morning to the Board of Supervisors. Gary Pace, Public Health Officer of the county, and I'm here to do the coronavirus report. So the situation statewide and regionally is worsening significantly. We're having an increase in cases, hospitalizations around the state and around the country. The governor's office is quite concerned about what's going on and is adding more restrictions back on. In Lake County, we are actually not doing too bad at this point. We have a total of 121 cases since the beginning, with 30 active cases at this point. 4 people are in the hospital. One of those is out of county, so there's 3 people hospitalized locally. So I would characterize where we're at in terms of cases as kind of an increase in cases from where we were a couple weeks ago, but it's not escalating in a worrisome fashion right now. The part of the concern, though, is that we are seeing a bunch of different sources of infection. So when we go back and trace them, we're able to sometimes identify where the source case was, and other times we're not able to do that. And it's popping up in different places around the community. So that's part of the concern, is that it's starting to be more widespread and has the potential to really take off. We're also seeing some more concerning patterns where, for example, some healthcare workers have tested positive, but I think that it looks like they've been able to contain that in those facilities, and so it hasn't really taken off there. We're seeing several workers out in the essential workers out in the public that are testing positive. Again, those have not had widespread spread, but this is kind of the pattern that you can see in other places when things really start moving along. So the governor has put more restrictions down because of his concern about where things are going. I think what we're seeing now is that the curve is starting to really escalate in the state, and we're starting to see, so the increase in cases has happened. We're starting to see, usually there's a lag time of a couple weeks. We're starting to see some increase in hospitalizations around the state and some pressure on some of the hospital systems in other areas, not so much in our region right close by, but it's moving closer. And usually then within a couple weeks, you start seeing a rise in deaths. We haven't really been seeing that too much yet, but the concern is that with this lag time that it's going to be coming down the road. And any interventions you do take quite a bit of time to basically impact this trajectory and sort of slow it down. So one of the things the governor is very interested in is trying to slow down the number of cases, trying to slow down the number of sick people in time so that we can open schools. If the situation is the way it is now, I think it's unlikely that they're going to be allowing much opening of the schools. Very controversial. There's a lot of discussion going on about this on a lot of different levels, but if we are seeing this kind of increase in cases, it's probably going to be much harder for him to be willing to allow that to go forward. So there's this whole thing with the watch list. there's these metrics, the variance metrics that we talked about 6 weeks ago or so, where we're looking at cases, testing capacity, hospital capacity, things like that. So basically looking at how we're doing in each county in terms of COVID and our response to it. So on our hub, the metrics are up there so people can look and see what we're, the way the state is measuring our metrics. We are also trying to measure those internally, and they correlate reasonably well. And we're actually in the process of getting an epidemiologist to come on part-time to help us kind of sort through all this stuff. Most counties have an epidemiologist on their staff. We have not in the past, and but it's somebody that we will certainly benefit from in this time. So we're looking to hire somebody as a contracted, very part-time, but to help with some of this. So in terms of the metrics, if a county gets into some problems with the metrics where it looks worrisome, the state puts them on this quote watch list. And so last week there were, 20 counties on the watch list, and they got restricted in terms of bars and restaurants and so they started limiting some of the activities that had been allowed previously. Over the weekend, yesterday, the governor came out again with a new mandate because of the worsening situation, and all the counties that had been on the watch list at that time got additional restrictions, and all the rest of the counties got the restrictions that were on the original watch list last week. So now the whole state is in getting restrictions added back on, and we're kind of working backwards through the process that we did coming forward. And I suspect there's more restrictions coming down the road. So there's basically two levels of it now. One is the whole state is in this situation where bars are closed down, indoor dining at restaurants, wine tasting, indoor service at wine tasting, brew pubs are closed, family entertainment centers are closed, and museums. The next level of restriction that does not apply to Lake County at this point, but applies to the counties that are on the watch list, involves other businesses, personal services, hair salons, basically most businesses that do business indoors but are not considered essential are needing to close. And I can go through all that as the specifics if you want, or people can find that online or on the governor's announcements yesterday. I suspect there's probably more steps that he's anticipating, and I think probably the easiest way to think about it is to look at the order that they were closed down in. He seems to be kind of going backwards with that, especially focusing on indoor activities and large group activities. The metrics, so on our metrics, we are actually reasonably stable at this point, although we're kind of at the borderline. We did talk with the state liaison last week. He said we were not on the list. We apparently yesterday the governor mentioned something on his press conference that Lake County was mentioned in terms of hospitalizations and ICU utilization, but really those are not COVID related. We're doing okay in terms of COVID hospitalizations, and so we're going to meet with the liaison again today, and we're going to bring that up because that's kind of where you get into that discussion, like, are you in trouble? Are you not in trouble? Are they interpreting the data correctly or not? And so we're going to go ahead and engage in that conversation today. And so far they've been pretty reasonable, so we'll see how that goes. So in terms of the watch list, I think we are, it's a distinct possibility down the road, and we're not there yet. And I would like to kind of emphasize that I think this is all very positive way to respond to things. It's very concerning. It's hard to slow the transmission, hard to deal with these things once the hospitals start filling up. And so the tried and true ways of doing this are to slow down social interaction and group gatherings. It seems like that's really where a lot of the transmission seems to be occurring, is in social gatherings of people from various households that are coming together, especially when they're indoors. So I want to talk a little bit about the different responses that we can do to try to turn this thing around and try to prevent the real problems that very likely are coming down the road unless we can stop it. So one is the sort of the public health clinical response, and these are the things I talk about pretty regularly: the testing strategies, contact tracing, et cetera. So I just want to give a brief update about each of these. So for the testing, we are continuing to run the Verily sites 5 days a week. There continue to be problems getting adequate appointments, partly because people are coming from out of town and partly because there's just increased demand. We have extended the hours now to be from 8 to 12, 5 days a week. And there are workarounds for people that are having trouble getting appointments through the computer appointment system, et cetera. And we've also been working, the lab situation has been a problem. The public health labs have pretty much closed off to our ability to use it. We don't have a county public health lab. Other counties do have invested in that infrastructure, and we've not done that, been able to do that here. We were using Sonoma County, that's been closed off. Richmond is overwhelmed with things, so they're focusing on particularly high-risk situations. We are using the UCSF lab that is available at least till the end of the month, and then we're probably going to have to scramble again after that. And then Quest is backed up 7 to 9 days sometimes, and which is very problematic. But there's not a whole lot we can do about that. That's really a much larger systems issue. There are some commercial labs that we could probably contract with. We have not done that at this point, but I think we're going to need to start exploring that. But it's an issue of cost. Each of these labs is, well, generally over $100 a piece, and so it's possible to contract to dial it down. But so then the contact tracing piece, we've been, because of the increased number of cases, the increased workload, our public health nursing is pretty stretched doing this. We are now expanding out to bring in some other folks, getting some volunteers to help, getting some folks from other departments in the county government, and also the state has a contact tracing hub that they've sent 4 people, well, basically remotely working 4 people on that, and they just started yesterday, so we'll see how that goes. The homeless and the vulnerable population, so these, again, I'm kind of walking through some of the public health and clinical responses to the COVID, so how we're kind of giving you an update on how we're responding. So the RFP is still out for the services around the homeless. So I think that ends by the end of the week, and so we'll see if anybody takes us up on that. If they don't, then probably by the end of the month that the services may just have to languish until the Hope Center comes on board in September. The other vulnerable populations, we're continuing to try to monitor them as best we can with the testing strategies. The surge of the hospitals, both the hospitals are doing fine at this point. They have strategies that put in place a couple months ago, and so we'll just have to keep monitoring that. For us in the health department, we've been really the main ones kind of directing this whole response and staffing it, and it's been, several months now. People are working 7 days a week. There's been a huge amount of overtime that's been used over all this time. And we've been sort of realizing that it's not sustainable how we're doing this, especially as the number of cases rises and expands. And so we're trying to reorganize and trying to figure out a way to bring in some more people and help kind of with a long-term process, because we can't just have somebody come in and help us grind the data or anything like that. It takes a little kind of orienting, and then that takes one of our staff away from the jobs they're doing already. So we're trying to figure out how to do this. I just think it's important that the county is aware that as things are worsening, it's really going to be a bigger issue than just the health department needs to step up more, because we're pretty much at maximum capacity, pretty much the pedals to the floor right now. So I think it's really important to let you all know that we are going to be needing some help and going to be, if things go the way it looks like they're going, that we're going to be needing some more staffing to help move forward with all this. The hub is another, so that again, part of the public health clinical response, the hub is up. Some of the demographics is up, updated weekly. The variance data is up. And, so that's kind of going. And like I said, we're doing the best we can without an epidemiologist. We've not been contracting with one, mainly because of concerns about finances. But now, given the pandemic, we really need somebody to help us with all this. So we have somebody. The contract is working through the system now. So hopefully within a week or two, we can get it. So now moving into the more prevention part of it, this is where the masking and everything comes on. So masks continue to be required with the governor's orders. I think, it seems pretty clear from the evidence that's out there that masking does help. All the countries that are using it seem to get better response. All the major organizations are recommending masking as a way to slow the transmission. Our experience with our contact tracing is when people are wearing masks, it's much less likely that the identified case will have spread it to their contacts. So when we're doing the contact tracing, if the nurses find that both people have been wearing masks, the chances of the other person testing positive seems to be much lower. What we're finding in our kind of going through as the cases are emerging, it really doesn't seem to be that bars and restaurants, we haven't really been able to identify that that's where the transmission is occurring. It's much more either somebody that's been an identified case that comes in and visits family from out of the county, or that it's a large social gathering. So multiple families coming together for Father's Day, 4th of July party where a bunch of people come together. That seems to be where in Lake County the larger transmission is occurring through these social events. So, social gatherings, multifamily gatherings are not permitted under the governor's orders, but, people are going to get together, especially after months of being told not to. And so clearly being outdoors is better than indoors, wearing masks is better than not wearing masks. All these things help decrease the transmission. The more we can do that, I think the more our businesses are going to be able to stay open. The more our numbers rise, the more restrictions are going to be placed on the businesses. So again, I went over the governor's orders. I think what we're really seeing is that they are going to really drive where this is going. For a while, I was kind of interested in figuring out locally what things we needed to shut down or not shut down, but it looks like the governor's going to be monitoring this data and moving forward aggressively to shut things down that they can shut down. Part of the problem is that because there's not a whole lot of compliance mechanisms in place, they are choosing the things that they have the ability to put leverage on. So, for example, the bars, I think partly because of the ABC board that they can actually go in and have some impact there. They're mainly working in businesses because of licensing issues, and OSHA is another way that they're starting to do this. And also there's this kind of strike team that they've talked about that they're sending into the particularly problematic counties where things are really at a high level, and the hospitals are getting overwhelmed and people are having to be transported out. So that's a state group that goes in and visits the businesses where there seem to be problems. So I think it's, the general strategy from the state seems to be moving forward with closing down businesses, kind of working backwards on the reopening plan that we saw, and trying to really bend this curve in the ways that seem to have worked in the past by basically just shutting down social movement and social activity. Unfortunately, the way they seem to be doing that is through the businesses. And, I think the schools are going to be a part of this equation. Exactly how that's going to play out, I don't really know. So part of the last piece I just want to talk a little bit about is the compliance piece. So I think as the situation gets worse, it's worthwhile for the public to be aware that the more they can wear masks, the more they can keep social distancing, the more they can avoid large gatherings, the better it's going to be. How to go about doing that, messaging helps, but I think the people that are open to that kind of discussion have probably heard it by now, and the people that aren't open to it, talking about it more doesn't seem to help that much. There is an issue of the state sends money down to the county, as you all well know, and the governor is threatening to withhold some of that money if there's a concern about compliance. So it's not exactly clear what that means. Does that mean if the businesses are blatantly refusing to close and nobody's doing anything about it? Or does it mean that if there's no kind of enforcement with masks, it's not exactly clear, but I think there's definitely an anxiety that if we are perceived as a place where not working on complying with the governor's orders, that there might be some risk of the funding being withheld for some of that. What else did I want to say about that? So, I think, I think that's basically most of where we're at. I'm sure there'll be some questions and concerns, but, I think the synopsis is basically things are looking pretty concerning around the state and in the region. The 5 counties around us are all on the watch list: Sonoma, Napa, Solano, so a couple others down that way. Mendo is not, and Tehama's not, Colusa's not. But, it's definitely moving up. It's worsening. There's the curve continues to rise. There's no slowing in sight right now. So the governor is taking very strong action, which I think is a good idea. And hopefully our relative isolation and the fact that people are doing a pretty good job of sticking with some of this will allow us to avoid this. But once things start getting in an escalating fashion, it takes weeks to turn it around. And so I think the more we can do right now, the better it's going to be. And I think I'll stop there. Thank you.
Okay, thank you very much, Dr. Pace. We'll go ahead and open it up to the board. And I can't see, if you can just raise your hand there. There you go, Supervisor Brown.
So, thank you, Dr. Pace. That was actually probably one of the most encouraging reports that I've heard, because there wasn't a lot of alarm in it. It was just laying it out there. But one of the things I want to clear up, you mentioned essential workers are testing positive, and I think there are some people that would be quick to jump to that they caught it where they work, because it was mentioned that they're essential workers. But that, from my information, that doesn't appear to be the case. That they may have been infected somewhere else, and then were somehow. There's a lot of cases out there where it's ancillary to their work, and we don't have. I haven't heard any evidence at all of any place that any business or hospital locally or anything like that where there's been a spread based on that work environment. Is that correct?
Well, what we're seeing is there's a kind of a surprising number of folks that are frontline workers. So food establishments, things like that are testing positive. And some of them were able to track back to a known case, like you're saying, and some of them were not. So the assumption, right, it's, so we can't really trace it back to their job. I mean, who knows? It's, but
well,
it's,
okay, and so here's the reason. And it's not because of anything you said. It's just that, the social media folks who have clearly nothing better to do than to trash businesses that are just trying to make a living, hear that a local business, somebody that works there or drove by there or something was infected, and so they automatically attack that business. And so, that's the point I'm trying to make, that, people are jumping to conclusions. to all these kinds of things. And, I don't want to add to that by making any implications. So we don't have any evidence of that. We don't have any evidence of a business being responsible for any spread. I've not heard any evidence to that whatsoever. And in any business that I'm aware of where they've either had an employee that was infected or exposed, most of the cases, by somebody who they were living with or associated with, they've taken extra precautions to make sure that it didn't spread. So there's no evidence there's more evidence that they've taken the precautions and they've been effective. So I just want to make sure that the public hopefully we'll hear at least that part, because typically they hear just what they want to hear and then run wild with it and offer rewards and everything else. So I just want to make sure there's a clear distinction between essential workers getting infected and causing a potential for infecting the public and them getting contracting the virus outside of their workplace.
Yeah, I would definitely agree with that. It's that's a really important point, because what we're finding is, so if we find somebody that's turns positive and we contact them and they say they're working in a food establishment or grocery store or something like that, then we encourage them to contact their employer. If they won't do that, then we'll contact the employer. And we've had really good luck with the employers taking the proper steps, which are to inform the other workers, inform the public, and disinfect. So I think the encouraging, having the public realize that the business community is being responsible and transparent when these cases come up, and that they're taking the proper steps is a really good point to emphasize. So thanks for that.
Okay. Supervisor Sabatier?
Thank you very much. Thank you, Dr. Pace, for the update as well as some of the clarifications. One of the clarifications I really appreciated was the clarification from the governor's address yesterday. I got a lot of calls and a lot of emails about Lake County being mentioned, and similarly to what Supervisor Brown said, it's like they only heard a portion of it or just heard Lake County and kind of ran with it. He was definitely talking about the hospitalizations, and I appreciate you clarifying, because I was also stunned at his statement when we only have 3 hospitalizations here in the county, versus we're taking care of the other people that also need to be taken care of, because other diseases and other ailments do not stop because of COVID-19, and we should be taking care of those people. And so if our hospitalization is increasing because we're taking care of the standard everyday situations, then that's not something we should be ignoring. Granted, we do need to watch the number of beds that are being used, and we need to keep track of that. But to make such a statement on a statewide address, I thought was ill-advised by Governor Newsom. We all make mistakes, though. You brought up testing out of town, and on Monday, I was volunteering at the test site, and the number of folks that came from Stockton, Napa, the Sacramento area, and Santa Rosa was, in my opinion, alarming. We have these conversations about, no social gatherings. We want to try to stop the flow of access. And this test site is a hub of doing everything we're being told we should not do. And granted, it's a statewide test site, but my question is, I understand why it's possible, but why are there conversations happening to prohibit the movement of people from highly infected areas to not highly infected areas just so they can get tested? Because that doesn't sit well with me, as we're telling the people who live in our communities that they shouldn't be doing those exact same things. And so I'd like for us to figure out how we can better control that and better, obviously, what's going on is not necessarily anything being shut down. It's too many people looking to get appointments in Napa and Sonoma County and the Bay Area, wherever they're coming from, and it's easier to come and get an appointment here where you can get tested quicker. Unfortunately, everybody knows right now that you get tested 7 days is probably the minimum amount of days you're going to wait unless you go through some sort of high-speed test because you're going through surgery or some other different situation that you're going through. So I'm very concerned about that. It goes against everything we've been asking to do. We were concerned about the lake, and now here we have this testing site, and it's bringing people here. It's not the lake, and so I'd like to see what's possible to be done with that. My opinion is just that, an opinion for the governor's funding. We actually have a masking mandate here in our county. So for them to say that we are not following their orders and to hold off on giving us any of our funding would definitely be met with frustration on my end. We have laws coming down the pike from the state of California that says we can't jail people for hardcore drugs anymore, but the masking is going to be an issue. I just don't understand the logic of what we're intending to do. The idea is to get people to comply. Yeah, that's a separate conversation, but I don't think our funding is going to be jeopardized whatsoever. And if it is, I'm not going to be very happy about this situation. I feel that we're doing well. I like your report. It's unfortunate that we are seeing a rise in cases, but we're managing it, and it's still within our control as far as the number of cases, as far as the hospitalizations. And I believe that, I don't know if I heard you wrong, but you were talking about the number of active cases that we currently have on July 2nd, based on the information on the hub, we did have 44 active cases. And so we have been going down as far as since July 2nd. We've gone back up a little bit. On July 7th, we were at 18, but that is not the highest we've ever been. And so hopefully we can kind of maintain within that level and not seeing it go out of control. And again, nobody can tell us the future. We're going to have to see the way it goes. But yeah, I wanted to mainly bring up the testing site. That is a huge issue for me, and love to have a conversation on the side to see what we can do to try to refrain people from coming in. As we progress into what the state is deciding to do, I'm just going to put it back out on the table. I don't know if it's a good idea, but it's just an idea. Maybe it requires a conversation to really find out that this is really stupid, or if it's actually the better way to go. I would prefer looking at a way to block our county from those coming in and utilizing that quick 15-minute test for those that have to come in, such as truckers that are bringing in our shipments, so that we can have food in our grocery stores, than to watch us have to shut back down. And so I think that there is an alternative to this. It might not be the easiest, and it may not be possible, but I think it's a discussion we should have, because shutting down again is, to me, not gonna work out for us. I don't think it's gonna work out for anybody. I think that we are relying on government to save us by telling us not to work, and yet government is relying on people working to be able to save those who need from the government. And so at one point, this whole system is gonna break down. We have to figure out a better way. And so just putting it out there that I would like to have that conversation to see what the possibilities of it is. Because if we can control the ins and outs of this county, then we can go ahead and continue to do what we're doing right here. Thank you.
Supervisor, just want to respond to the Verily question, because I agree with you. It's very frustrating. It's frustrating on a bunch of levels. One is the people coming from out of the area. The other is we have a very precious resource, which is our nursing staff and our other support staff, and we're staffing that thing for the most part, and drawing those people away from that to do this. We've been in conversation with Verily. They say absolutely they are unable to limit it due to where people are from, because it's a state resource. And so, from our point of view, there's not much to be done about it. There may be some way where lobbying on your level could help with that, or to at least put some kind of guardrails in so that we could guarantee a certain amount of space for our residents, because that is a real issue right now for access, and also just for numbers of tests we're able to perform, because we don't get credit for the tests that are done for people out of county, so.
And if I can,
No, you don't.
if I could follow up on that real quick, I have a meeting at 3:30 if we're done with our Board of Supervisors meeting with the state and CSAC, and I will make sure to bring that up because I'm sure it's not just us that's having this issue, and I'm 100% sure it's a rural issue where the larger populations are seeking out ways. And what is really a tragedy for us is people who want to get tested right here, right now, have to wait a week or two in order to get their appointment because every other appointment has been taken up by people that are from out of town. And also, I was able to get a contract of the between the state, the county, and Verily. And it says on the contract, and I don't have it right in front of me, so I'm absolutely there it is. Let me see if I can open it up real quick. But it says that Verily is supposed to provide the staff for the test sites, and that is not what is happening. So in my opinion, we are failing to adhere to the contract that has been signed. It is unfortunate that this is what's going on. I don't mind volunteering, but we're asking our staff that are so needed at the public health office to not just be busy taking care of out-of-town folks, but to do other things. Like you were saying, we're short-staffed. You're looking for epidemiologist. I'm never going to say that right. I need to practice. But at the same time, I'm looking at this contract, and this is not what is happening at all. And so I would like to definitely take that up because that to me is not what is happening. And I'll be back and I'll read the specifics of the contract, because it says on here that they are the ones that are supposed to put in the staff, not us. And I appreciate those that are out there. I am definitely say thank you to Lynn and thank you to Evilly, who's working hard out there. I know that also Chief Cepeda has gone out there and to do the testing. It takes certain knowledge and certain skills to be able to be in that position to do the testing, not the volunteer portion that I do with the traffic coordination. And so I really appreciate that they're out there, but I would want to make sure that either A, we make sure Verily steps up to the contract that was signed, or B, in there it says that we can submit for reimbursements for the use of our staff, and I would say that we need to make sure to reimburse at the overtime rate.
I got a question.
Supervisor Scott had her hand up. Go ahead,
Okay.
Supervisor Scott.
You know, on that same note, I also would like to see Lake County residents have priority to get tested if there is a way we could make that happen. And do we have an idea of the percentage of how many people that are getting tested local compared to out-of-town people?
Yeah, I'm not aware that we have that exact percentage, but I think the general census of people that are out there, that it's something like 50% or something like that. It's, it's changed. In the beginning, it was pretty much most of our folks. And I think what's happening as the demand is rising because of these increasing cases, and there's just overflow from other counties, and they get in line first. And so we've had these conversations with Verily. We've not had any success. We've had the conversation about the contract issue, about them providing staffing, and they're like, it's not going to happen. So, we're kind of day by day just trying to get along through this. But any advocacy from your point of view that could happen would be greatly appreciated.
I definitely think this is something we need to keep pushing to make sure that our residents are getting the test here in the county.
Well, is there any
Supervisor Brown?
Is there any evidence that our residents aren't getting it? I mean, so I remember a few weeks ago, we stood a risk of losing this program if we didn't have enough testing done, and that was why I thought it was opened up broader to get those numbers so that we kept the testing site. Now we're hearing that we're overwhelmed because of 50% of the tests being done for out of county. I'm trying to get a sense of that.
Go ahead, Dr. Pace.
I mean, I think what's happening is there's just more demand. People a month or two ago were didn't really feel much at threat, and I think that's changing as the number of cases is going up. We're trying to read the tea leaves of the state, really. They don't communicate directly in a lot of ways. There was some rumblings that the smaller counties that weren't getting that weren't getting adequate numbers, they were talking about consolidating, and that's clearly not going to happen at this point. Now the problem is the whole contract ends by the end of August, so we really only have 6 more weeks of this contract, and then the expectation is that the counties take on the contract or figure out a different strategy. So we're sort of scrambling with how to think through that and how to work with that.
Is this by appointment or just drop in?
It's appointment. It's
So,
appointment online, and and they have a number of spots.
Okay, so Bruno suggested he had some thoughts on it and he wanted to have a conversation, but I'm thinking, let's have the conversation. Let's do it right now. But one of the things that I want to know, are we still doing testing down South County?
Yeah,
One day a week?
yes, it has rotated now. There's been a request to have testing. This week it's in Upper Lake. And then the following week it'll be back down here in South County. So
Got it.
there was some juggling by the board, obviously, to get testing up in Upper Lake. It was being every other week down in South County, but now they've moved one of the days to the North Shore.
So is it possible, and I'm just throwing this out there, I don't care one way or the other, and I certainly respect the wishes of the board members whose district that's in, but is it possible to make those out-of-county appointments at one of those closest to the border so they don't have to come all the way into
Lakeport or Clear Lake.
into Lakeport or Clear Lake, yeah.
The way the process works it's basically that it opens up online, and whoever gets the first appointments, fill up the appointments, and Verily, it's a Verily platform, and they say because of the state support that's funding it, that they are unable to limit who signs up where by location. So again, these are conversations that are good to have. We feel like we don't have any control over it. We've tried to reach out and have that discussion, and we've not gotten anywhere. And it's sort of like, this is the state contract. This is so.
Well, and I get it, and you made a good point that we've got 6 weeks left, and the way the state works, unless they're shutting down businesses, on every other aspect of resolving an issue, they work the speed of smell. So I don't think it would be resolved before the end of August anyway. So.
Supervisor Sabatier?
And just to read off of the contract that I have, in section 1.3, it says, for the Verily operated sites, except as otherwise agreed by the parties, which I'm assuming that we did not agree to, Verily is responsible for all end-to-end operations in connection with the program, including event space, supplies, staffing, including contracted healthcare providers, security, and day-to-day logistics. Now, I know for a fact that Dean from Public Health has been absolutely critical in any event space that we've been needing to get these sites at, and that our staff has been the HCPs, the healthcare providers. Later on, it also says 1.4, call center support. Verily will operate a call center to provide support for participants experiencing issues with using the platform or scheduling an appointment. We're offering them a local number where our public health is helping them get those appointments in if they're struggling. And so I just think that we need to re-review what the state is offering us here, because we want to make sure that we're getting the best possible service. And also later on, it says in item 1.11, as needed, medical personnel, healthcare providers, HCPs, when agreed in advance by the state, Verily may provide subcontracted HCPs. Verily shall ensure all such personnel have requisite qualifications and licensure. ACPs shall be billed at the not to exceed rates identified. It would be nice if we can make sure that our nurses that are out there can maybe go under this HCP contract with the state so that we can get reimbursed for their time. It doesn't bring a person back in the office, but at least it doesn't use our funding when this contract says that it should be the state's funding. So I just want to make sure we get the maximum amount out of this contract. And I'm not seeing it from my experience of volunteering there. I think we're doing a fabulous job in getting the tests done, but I don't think that the logistics of the entire process is being efficiently used.
Mr. Chair, I just want to say, Carolyn, Director of Nursing, did do the data pull, and she's saying that it looks like 22% of the people that have been getting the testings, I'm not sure the time frame, were from out of county. So it's not as high as I thought, but it looks like it's about a quarter.
Okay, thank you very much, Dr. Pace, for that clarification. All right, Supervisor Crandall?
Yes, and so I just wanted to go back to the in-county testing. I know in the last couple weeks I've had quite a few constituents call and ask because they don't have access to the internet and things of that nature. So I know that I've forwarded them either to the Mohawk or have tried to facilitate on our end to get them to either the emergency room or to someone from the health department in order to get them testing. So I know that I think it's just kind of they're catching up with the system too. So that and at a certain time they weren't needing the test, but now people are getting sick and they're finding out, well, they don't have COVID, but they have pneumonia, or they don't have it, they have something else, but they're getting these tests. And so I'm seeing a lot more activity in that. And I'm glad that we have it on the North Shore, and it'll be this Wednesday. And I've also been getting a lot of correspondence from nurses that are talking about they're worried that, you know, with the high amount of cases, Dr. Pace, that they're now having to they're worried at home that they're going to infect their family. So they're not staying with their significant other. They're quarantining from them. They're staying out in their garage or whatever the case may be. And so I like this discussion that we're having about ensuring that less folks from out of county come in and take these tests, because it makes us acceptable altogether. But also with the hospitals, I think of that of like, you know, in wartime. The enemy knew at one time that they just injure somebody rather than kill them because it took 2 soldiers to take care of them. It's the same concept with nurses. If they get infected and we don't have anyone to take care of them, eventually we're stuck at a point where we can't recruit anybody from outside. And so I like that we're having this discussion about, you know, limiting people coming in. And I think that one of the hardest discussions to have would be about the vacationers and whatnot, because if we're going to look at people coming in for testing, we kind of got to look at that too. And so that's going to be another tough conversation. But I only bring that up because I've had quite a few nurses reach out to me about this. So I just wanted to bring it up.
Thank you, Supervisor Crandall. Okay, Dr. Pace, I would like to clarify, can you clarify the contract that we have currently with Verily? The state has a contract directly with Verily, and then we've contracted with Verily just to be in our county. Can you clarify that contracting issue?
I'm not sure I know the answer to that. The state is contracted with Verily, and they are providing basically there's some Verily staff. They have a mobile unit, and they have the platform, the data platform. And really, from my point of view, the biggest thing they provide is they're paying for all the tests. So, you know, that's a significant amount of money every day that it's open. And once that goes away, we're going to lose that access to the testing, to the lab. So I'm not sure exactly what it is. I mean, you know, I was under the impression it was basically like the state decided we were eligible and they provided it. Let me see, maybe Denise.
Yeah, if I could add to that, Mr. Chair, it's a resource provided to the county by the state. The contract is between Verily and the state. The county does not have a contract with Verily, and the county is not a party to the contract between Verily and the state.
I slightly disagree with that, because there are county mandates within the contract of what we're responsible for within the contract.
And also have Denise Pomeroy, who had her hand up. Denise?
Hi, Carol said what I was going to say, so thank you. The contract is between the state and Verily. And Verily was appointed to our county as a resource, and they're paying for all the tests, and the platform.
Yeah.
And just to clarify, it's not that we have the contract, but we have expectations of what we should be doing as number 2 in the contract says state and county activities, county shall, and things like that. And so we are a part of this contract, even though the contract is between Verily and the state, because we're not paying for Verily.
Yeah, and the clarification I guess I wanted to have on that conversation is another agenda item we're going to talk about today, which Carol will do, is the funding that's coming down from the state. So when you're talking about funding to do these things and asking the state to do it, we're going to have a conversation about COVID-19 funding later on the agenda. So I think what you're asking is already being provided, but as Dr. Pace has made it very clear, the enforcement part of compliance with the governor's orders and other things are also going to be a conversation along those lines. So I just, wanted to clarify what the responsibilities of Verily and the state were. And then we look at our responsibilities as far as compliance along with the orders, which include enforcement. And then also what we're going to be doing later on in some other agenda items. So I just wanted clarification for that as we move through this conversation. Dr. Pace, I want to thank you very much for, getting out there were some press releases yesterday. I appreciate the way it was done as far as, just releasing what the governor had done and the steps that we have worked on. This is going to be a long process. We've had this, probably till the end of the year at least. We're going to be having these conversations as we move forward. And I agree that what's going on around the state is alarming. To think that we're going to be any normal, state of life or operations here over the next 6 to 9 months is, wishful thinking. We can all do that and hope for these things, but we've seen the direction it's been moving. So I appreciate all the reports. I appreciate all the work. I am concerned, as you sat here today, saying that you guys need help. Our folks who've been on the front lines have been working diligently, and we need as a board to really look at what we're going to be doing down the road with hopefully some of these other funds that may be coming in and opportunities from the state. So today I want to just thank you very much for everything that's been done and all of our hard work that's been done by all the volunteers and everybody on the front lines.
I do want to ask one question, and it's kind of rhetorical, but I don't think...
Go ahead, Supervisor Brown.
I don't think Dr. Pace has the answer to it, but maybe somebody out there does. We talked about this funding that the governor's dangled out there, and so people are concerned. First of all, they thought we were going to lose funding. Well, we don't have it, so we can't lose it. So it's just extra funding that we may or may not get anyway. But if we were to assume that every county is in compliance and every county was getting the bribe money. How much would we actually get? What is it that we're actually talking about before we get too carried away and start paving the streets with gold of all this money that we're gonna get?
Mr. Chair, Supervisor Brown is actually referring to agenda item 7.6, and there's almost $9.5 million at stake, and I'll give the board a full report.
Is that part of the $1.5 billion that, and I know it's another agenda, but I would like to ask the question now if I could, because he brought it up.
Lake County's share is it's $6.4 million in CARES Act funding, and then approximately another $3 million in realignment backfill that benefits law enforcement, social services, health, and behavioral health.
So is that the $1.5 billion coming out of the $1.5 billion that the governor said that he was available, or I think it was 1.5, maybe it was 2, I don't know, billion dollars that was available to counties that were in compliance?
Yes.
Okay, so there's 9 total, because CARES Act is different than that, so that's why I'm confused.
Yeah, it's just under 9.5 million total is both CARES Act and realignment backfill funding that has been allocated for Lake County.
Out of that money that the governor?
Yes, it's federal. Let me be correct here. The CARES Act funding is federal funding that passed the state, and they're passing on.
Yeah, I don't want to be confusing the two, and maybe we can wait till this, but I want to make sure we're not confusing the two and And,
Yeah, and, that's another agenda item. We will go into that a little bit more. And Carol, thank you for the explanations.
But there hasn't been an explanation, so I don't know what there's to be thankful for. I haven't heard an explanation yet, so I guess we'll wait until that comes up.
Well, I guess I heard something different then. Carol, could you just give us the numbers again, both from the federal that goes through the state, and then the realignment backfill?
Since it was the question I asked, maybe I'll re-ask it if I could just get the answer. Out of the money that the governor said he placed in the budget that would be a reward to counties that were in compliance, how much of that money would come to Lake County? Because there's no...
I'm not familiar with funding that has been given to us as a reward. The CARES Act funding is to offset our expenses to date and our continuing needs to manage and mitigate the impacts of the disaster. So
we're going to get that no matter what?
No, we're going to get that if we remain in compliance with all of the governor's orders and the California Department of Public Health orders.
I'll research and find out exactly what, he just recently put it in his budget, and it had nothing to do with the CARES Act. And
we are going to have a longer conversation on this, Rob, on another.
On a different subject altogether. This is not about the same funding. That's why I'm trying to, I don't know how much clearer I can make it. This is a different
I don't know how much clearer I can make it. It is on the same funding.
It's not on that funding. It's not. She's talking about the CARES Act and she's talking about realignment backfill. That is not the same. I'm not hearing that it's the same.
I'm familiar with a funding source that was described as a reward. I'm sorry, Supervisor Brown.
I don't think anybody's heard of anything as a reward.
Well, that's what the reward was. If counties were in compliance, that there would be funding available that would be rewarding counties for being in compliance. It's fairly simple. It's not complicated.
No, the only thing
it's not complicated. The amount of money that was just said is the money that you're talking about.
I don't believe you're correct. I don't believe you're correct because if only one county was in compliance, would one county get all of that money? There's no way for them to determine how much money we're already going to get.
No, Supervisor Brown, they've allocated it to counties, and the allocation Lake County stands to receive for CARES Act funding is about $6.4 million.
And that's the federal money.
Over $3 million of realignment backfill. So they've carved up allocations for counties, but again, it's not a reward for staying in compliance. It's to cover the county's costs that we have for the disaster to date and the additional expenses we will incur.
All right.
And the realignment funds is to cover the costs of our social services, behavioral health, and law enforcement programs.
Got it.
Okay, any more questions from the board for Dr. Pace? All right, seeing none, we'll go ahead and open it up to public. And Supervisor Sabatier, I know there are some folks in the audience there. We'll go through the Zoom room and then we'll go down to the participants that are in the boardroom. So I see a hand up here, Galaxy S10.
All right, Galaxy S10, I've requested you to unmute. It looks like you're unmuted. Will you please confirm your first and last name?
Yeah, Frank DeLoso, sorry. I wasn't quite sure how to put my name in there. It's just kind of interesting to hear how the county's being somewhat held hostage if businesses don't comply and stuff like that. So, the old quid pro quo, you do this or you're not going to get the state money. So, I know we're a lot of people on welfare in the county and stuff like that. But if we just move forward ahead and allow people to make a living and pay our taxes, we wouldn't have to wait for a handout. So anyways, I'm obviously, you can probably tell that I'm very much against this whole thing. We didn't do this for any other thing, SARS, Ebola, swine flu, or anything like that. And we were just fine. And I believe what I'm seeing with the amount of testing going on, we're testing more people than ever. And with with that testing, we're seeing more and more cases. Yes, we're seeing that trend upward, but on the other hand too, the death rate, the ratio continues to fall, because I've already known, Lake County is a small place. I already know several people that had COVID-19 here in this county. I've lived here my whole entire life. I know a lot of people, and those people are just fine, have recovered and are just fine. So, there are people going to die, just like, you can't stop all traffic accidents. You can't stop all drunk driving, but, we can't keep our businesses closed. We can't penalize those ones that are just trying to feed their families. Thank you very much.
I got it.
Thank you, Frank. Hey, the next hand up I see is Melissa Fulton.
Can I interrupt real quick?
Yeah, Bruno, go ahead, Supervisor Sabatier.
I think that we need to make statements when it's necessary, and that this is not the swine flu, this is not H1N1, this is drastically different, and to allow the comparisons without a rebuttal almost means that we agree with those comparisons. This is a new situation that we have not dealt with before. I might disagree with some of the actions that we've taken, but the data is pretty consistent in how drastic this can affect a community that does nothing. And so I think that we need to make sure to make remarks on absolutely faulty information that spreads information to go against what we're trying to do. And so I can't let that slide to say that we've gone through H1N1, we've gone through swine flu. Yeah, you're right, we have. And they were nothing compared to the numbers that we're seeing with coronavirus. And so I think that we need to make sure to not just sit idly by when those statements are made. Then the data is out there, and make sure to look at a reliable source. And if you don't believe the CDC, or you don't believe a doctor that has an actual standing in looking at these types of viruses rather than a YouTube doctor, then I don't know what to do for you, other than we have to rely on data that is accurate and that is brought to light at all times, and it has not changed over the course of time. The rates of death are very similar still today as they were before. And so we should not continue to allow these comparisons. We can act in different ways in how we react to this, but we cannot alter the data that we are looking at.
And I think, Supervisor Sabatier, you make a really good point. And I know that our public health officer has continuously from day one had the orders and been very consistent on the messaging that this is a new animal that we're dealing with in this world, in this pandemic. It is not all of the things that have been talked about, and I want to thank Dr. Pace for being consistent in that messaging as we do it each week. So next up, I think I have Melissa Fulton. Looks like you're still on mute, Melissa. There you go.
Thank you. I have received a message that Jake was the powerful unmuter, so I was waiting. Again, I thank Dr. Pace. He probably more than anyone in this county is definitely under the gun for all of this. And I have some questions because our dear governor seems to feel very free to throw out all of these commands, and he uses a lot of generalities when it comes to numbers of beds available and all of that, but he doesn't get specific. Other than to say we have, and I don't recall the exact number, over 7,000 beds available between hospitals and ERs throughout the state. I would like to know if Dr. Pace is aware of a resource we could go to ourselves without depending upon the governor's staff that will show us the total number of beds available in the state and a daily update of how many of those beds are occupied by, number one, the COVID cases, and number two, those for general surgery, I'll call it that. Because I think that's important for us to understand. Again, social media can be extremely misleading, as we know. I saw some factors last evening when I was going through some reports on the state of California as to the comparison between our COVID cases to our 40 million population throughout this state. The percentage.
2 minutes, Mr. Chair.
COVID cases and also the percentage of deaths. So I think there's a lot of information that the public needs to have access to without relying on the governor's generalities. And I'm wondering if Dr. Pace could provide that for us. And thank you.
Thank you, Melissa. Dr. Pace?
I think, so one of the sources that's actually really good for California data is the LA Times. They're keeping a pretty good update. They also, I'm just looking when you were asking, Melissa, that the CDC does have a state estimate for percentage of inpatient beds occupied. So it goes state by state. So you can go on this, if you just Google California hospital bed availability and look around there, it's the CDC does have that kind of situation. But the LA Times is a pretty good source of keeping up with what's going on around the state.
Thank you very much, Dr. Pace. Thank you, Melissa. Okay, Jake, let's go to the next name. I don't have a name. I see a hand up, but I don't see a name here.
The next hand we have up here is Sally Peterson.
Okay, go ahead, Sally.
Good morning. Thank you, Dr. Pace, for your report and the information that we received on the testing. And I appreciate Supervisor Bruno's comment on the out-of-county people that are coming in to the limited resources we already have in our county. I remember that it took quite a while for us to even get the testing started. So it's disconcerting to find out that there's other people coming in from other counties and taking up those appointments on a resource that was limited or still is limited. The Verily testing is already getting overwhelmed as it is. We're already waiting longer for test results to come back. So that is concerning, and I would like to hear eventually what the response is from the state on those concerns. And I did want to say that I did not appreciate the comment from Supervisor Brown about suggesting that those out-of-town people be directed to the South County. We're already limited on the days that we get our testing, so I just didn't appreciate that comment.
Well,
thank you.
You should have heard it correctly then if you didn't appreciate it, because that's not what I said.
I did hear what you said.
No,
I heard you say
you're mischaracterizing what I said. That's not what I said.
You made the suggestion that they be directed to the other outer by the borders.
I did not. I opened it up for discussion, and I said I would appreciate the comments and the input from the supervisors from that district. It's not something I was suggesting. I made it perfectly clear. I'm not sure what you were doing at that particular moment, but that's not what I suggested.
Okay, well, it's recorded, so it doesn't matter.
Yeah, it is. Go back and listen to it.
Yeah, you guys are disagreeing on something here, you know,
Well,
obviously
Jesus Christ.
major statements, and we'll go from there. Okay. Jake, we'll go ahead and go to our next public comment.
Yes, the next hand we have up here is from Johnny. Johnny, I've sent you a unmute request. Looks like you're unmuted. Will you please confirm with your first and last name?
Yeah, can you guys hear me?
Yes, we can hear you.
Yeah, so I'm just a couple of questions. I don't understand why we're so worried about what's going on statewide with the uprise in cases when our county is still, yeah, we're seeing an uprise, but we're managing it? Why are we basing our restrictions, our limitations off the rest of the state? Shouldn't we just be worried about our county? Our death rate is still very low, even if that one death is going to be considered a COVID. I mean, neighboring counties, that's not us. We should just be worried about us, not anything else. And you talk about getting information, the correct information about this virus or whatever. What is the correct information? The CDC has came out and said that they mix up tests, that the test numbers are not as accurate because shit's getting mixed up. So who has the correct information? It's just it's a mess. I mean,
if you could watch the language, we greatly appreciate it.
So I want to know who has the correct information. I mean, you can say you have it, I can say I have it, but nobody knows 100% who has the correct information. I mean, it's like I said, it's just mind-boggling that we're still worried about what's going on with the state and not just our county. I mean, the uprise is going to happen, and this testing site, if everybody's so worried about it, why not just kick them out of the county and the county continue to do testing like we did before they came in? That's all I have to say.
Thank you. Go ahead, Dr. Pace.
Can I respond to that? Thanks. Yeah, it's, I think that's a really good question about how to think about the region and the state. One of the things is that if people start getting sick in our county and we really, have a limited number of ICU beds and ventilators, and also both the hospitals, their model really is to ship people out of county if people get very sick or if they start getting very full. And so it actually matters a lot what's happening in the surrounding counties for us. If people start getting sick and need hospitalization, we're going to be totally reliant on the surrounding counties. The other thing is that because a lot of people work out of county and there's a lot of movement back and forth, that what happens in the surrounding counties eventually filters into us. There's usually some slow down times, there's some lag time, and we've actually done a whole lot better than Sonoma County. So, I absolutely agree with you. It's been very fortunate that we've done as well as we have, but I think it's essential to pay attention. And the other part of this is that really from the governor's point of view, they're basically making a statewide proclamation. So we don't really have, it's not like we are bringing restrictions in place that we have a lot of choice on right now. What's being brought in is the governor's orders that is going statewide. So thanks.
Thank you, Dr. Pace. Thank you, Johnny. I see another hand up. It looks like Melissa Fulton. Unless that's just still there from the last time.
I think I removed it the last time. I think that's up again. That does look like the only hand up that's up right now as well. Should I call on that again?
Yeah, we'll go one more time to Melissa, and then we're going to go to the people in the boardroom.
Okay, Melissa, I sent you an unmute request. Okay, there you go.
Yes, and so I have two questions. I can't get the video back on, but okay, there's the video. You referred, Dr. Pace, you referred us to the LA Times. I have a particular bias against the LA Times, but my question has to do with where do they get their information? There must be a location in the state where they get their information. I'm on their subscription list and I get their columns and everything, and they are way out. But the other thing is it even possible to ask the governor to restrict testing sites to only the residents of each county, so that we're not experiencing a 50% influx of out-of-county people coming to our testing sites? Is that something the Board of Supervisors and you should send a request to the state for? it seems only fair that obviously our residents should come first. And I would think.
Mr. Chair, that's 2 minutes.
I would think.
Okay, thank you, Melissa.
Might be able to do that. Thank you.
So I think, Dr. Pace, I thought you had the answers to both questions, obviously, and it's not 50%. I thought you clarified that earlier, but go ahead, Dr. Pace.
Yeah, so the place where we get most of our information is from the California Department of Public Health. So that's probably, if you don't like the LA Times has been pretty consistent with their data. You may not agree with their op-ed pages, but but if you go to the California Department of Public Health website, CDPH, that's where most of the data is gotten for this. The Verily site, we confirmed while we were on here. I initially did say 50% because that was the general impression we've been getting, but somebody ran the data while we were talking and it's 22%. So 22% from out of county. And we have had the conversation with the state. At this point, they're not willing to do that. But if some folks with more leverage than I do want to try to have that conversation with them, I think it's a great thing. I think like Supervisor Brown suggested, with only 6 weeks left, it's unlikely they're going to change much at this point. But can't hurt.
Thank you.
Yeah. Thank you, Melissa. Yep, I see one more hand up, Michael. Jay.
There we go.
Michael.
Can you hear me now?
Yes.
All right, thank you. This is one rabbit hole I just assume we not go down, the amount of out-of-county testing. If they're coming in, testing, and going back home, God bless them. At least they're doing something to take an effort to protect their health. I see more bass fishermen this weekend that would probably make any testing numbers coming in kind of pale by comparison. We have this disconnect between our shelter-in-place orders, where on the one hand, non-essential travel is supposed to be prohibited, but we have people coming in our county every weekend. So the idea that we should even try to limit testing availability to our county residents when it's a state-funded program, I don't even know why you would try to do that. I certainly have no idea how you would enforce it, because we can't force people coming from out of county to fish in our lake, and people are all for opening the lake. So I think there's a bit of a disconnect between the messaging the county has taken to this point to open up the lake, to keep visitors away, but to express concern suddenly when we get news that there might be some out of county people utilizing our test sites. That's just a disconnect. I don't believe that. The concern I did have, what I did hear from Dr. Pace, is the staffing of those test centers. So if you're relying a lot on volunteers or only public health staff is out there, that's a staffing issue, and that should certainly be addressed. But the attempt to limit out-of-county residents from using a state-funded test site, I don't think you have enough bandwidth or credibility on that to really go down that road. Thank you.
Thank you, Michael. And I would agree, we can always ask for anything that we want to ask for from the state, but I think if everyone remembers, I know that before we got the Verily test site here in Lake County, that it happened in Napa and other places. And I know that we had county folks, because it wasn't limited to just the county that it was in. There were spots, and I know folks that went and tested in other counties, and we still may have that situation where we have Lake County residents going and testing at other areas. All right, go ahead and could open up the room. We'll go ahead and go to the individuals in the room if they want to make public comments. I can't see the room. If
we have one individual who is coming to the microphone.
Or Dr. Supervisor Sabatier, if you could go ahead and take care of that.
Yep, we have one gentleman here who would like to speak.
Hello,
Okay.
testing. Is this on?
Please.
My name is Mike Raffinelli. I'm from Lower Lake. Dr. Pace, I was going to come here today and kind of complain that you haven't been telling us where the infections came from, and I'm glad to see that you have done that today, because I don't want to go to any place that has the disease, and I feel that, Napa and Sonoma County is places that I don't want to go. So thank you for that information. I'm glad you finally brought that forth. We have been doing putting a great effort in Lake County, and we have zero need to have our stores closed. We have been doing excellent, just like everybody says. All the cases came here from outside our county and gave us the disease. So, I'm in strong favor of kind of keeping our borders closed and not letting anyone come in here. Open up the lake to all of us around here. Open up all our businesses. That's no problem. We are all wearing our protection and doing what we're supposed to do. I'll say that when we have the fire situations, I know I've been kicked out of my house 3 times. And when they came, the police said, if you leave, don't come back. And I had the same thing. I know a couple people left here that are essential workers, went to whatever store they work in and came back with the disease. They should
2 minutes,
be.
Mr. Chair.
Okay. Well, all right.
Go ahead, go ahead and try and
finish up your
it
point.
here. Give me
Okay.
a couple more seconds here. Go ahead, Mike.
Okay. I was under the impression that we went from 46 cases up to like 96 cases, and that was migrant workers. I thought we mentioned that they were supposed to have be self-quarantined and tested before they came up here to go to work. Otherwise I would say send them back and take their work visas away. Thank you.
Thank you, Mike. Okay, do we have anyone else in the boardroom that would like to make comment?
I do not believe we have anyone else in the boardroom that wants to make a comment.
All right.
We have other people in the boardroom.
Yeah, and I can't see. Okay. All right, so we're going to go ahead and bring it back to the board. We'll go ahead and close down public comment. We'll bring it back to the board to wrap this up. Supervisor Spatier?
I just wanted to make a comment on what Ms. Fulton had asked about for the data. If you go on the California Public Health website, it has a lot of these details. You just have to download the actual raw data files. It's not all easily accessible, but there's a lot of Excel spreadsheets you can download that gives you testing numbers throughout the entire time since shutdown has occurred back in March. To death numbers, to positivity cases. All the information is available. It's just not easily available everywhere in the way that we would like to see it formatted, but the raw data is definitely available and it is constantly updated. And I believe that is how the LA Times and others are go ahead and collecting that data and providing it in a more friendly format for us to read. Unfortunately, the LA Times does not necessarily always provide information for Lake County, so you will see their breakdown, but typically they'll stick to the counties surrounding their area that they serve. So that is where I'm finding a lot of the data, and I know that we've upgraded our hub at the Lake County to offer some of those same data that is also available through the Public Health Department of California, and so that's a good place to get started.
Okay, thank you, Supervisor Spatier. All right, we're going to go ahead and wrap up this agenda item. Are there any last minute comments by any of the board members?
Yeah, I just want one more quick thing, and I have to apologize to Sally. Everybody is, God dang, I can't even tell you. It's just the tension for the last several months is not healthy. It's not conducive to coming up with ideas. And I just want to make it clear to her. We have to, in order to, or to anybody, actually, not just to her, I don't want to single her out. But this is we're trying to come up with ideas and solutions, and that's what I did when I suggest. I didn't say we should do that. I didn't. I just said, if we're going to look at options and keep people out of the middle of the county, I don't care. I don't care what the ideas are. Bring them to Kelseyville. I don't really care. If it's going to be the best for the entire county, I'm game for whatever. I just need to express that, getting rid of the hypersensitivity and kicking people down, when they're down, and trying to, limit other ideas and other thoughts is not going to help the situation at all. We all have to throw things out there. I've heard some of the dumbest things I've ever heard over the last 5 months, but I still listen to it, don't agree with it, and I can say I don't agree with it, doesn't mean I say I'm offended by it. It's just the way things work when we're having a public discourse like we're having. So that's what the whole object of this discussion is.
Thank you very much, Supervisor Brown. Okay, thank you for that last comment. We're going to go ahead and wrap up this COVID-19 report for July 14th. Thank you very much, Dr. Pace. And once again, I just, I know how, you've come here talking about the, the staffing and other issues. I just want to thank everyone in the county, all the volunteers, all of our folks who are working hard on this. We are early still in this, what we're dealing with, and I just want to know that, and I know each and every board member, we appreciate everything that's being done. So thank you very much. We're going to go ahead and close this item, and we're going to go back to item 5.3, and I will read that in just a second.
We can wait on that. I don't care about that.
Well, I'd like to have Dr. Pace here while we talk about this.
I got it. I figured he was going to be here for the closure of the courthouse and all that other stuff too, but it's your
So item 5.3 was pulled by Supervisor Brown. So item 5.3 is approve the continuation of a local health emergency related to the 2019 coronavirus, COVID-19, as proclaimed by the Lake County Public Health Officer.
Well, the reason I asked for this to be pulled off, because the consent agenda is usually held for items that are non-controversial, and I think that would be a mischaracterization of this entire subject if it was just everything beyond the consent agenda. So that's why I asked for it to be pulled off. I didn't support it in the beginning. I don't support it now. I think that declaring a public health emergency, there are issues that we need to deal with, but Dr. Pace's report today demonstrated very clearly that to me, it would be like, let's declare right now a public health emergency for fire because we're in fire season and it could happen. So I think everybody should vote the way they want to vote, but I'm not down with the consent agenda item, so.
Okay, well, thank you for pulling that. Any more comments from the board?
No, I will say something real quick. I do appreciate this being pulled just for potential conversation. I think that something that was mentioned, I believe it was Johnny during his comment in the last item that we had, why are we looking at the state? Well, we're all dealing with the same virus, and we need to learn from what's happening outside of our area rather than waiting blindly to learn how to best be prepared and how best to anticipate what we need to do. And so I think that knowing that there are absolute issues happening throughout the state, throughout the region where we are, in whether it's Sonoma County, Napa County, even Colusa County is having a huge surge, and they're on the watch list right now. This is an issue we need to keep track of, and this is an issue that we know can have a huge impact on us, as we have a very vulnerable population, whether that's elderly population or whether that's medically fragile population that we're very aware of. And so I think that this is the reason that I will vote to continue this emergency. Again, that doesn't mean that I agree 100% with some of the things that are being brought to our board or the actions that are being taken, but this part I do agree that we need to be on our toes and not caught on our heels.
Thank you very much, Supervisor Sabatier. I don't know if any other board members have comment on the health order, but yeah, I will talk on the health order. Obviously, I am in favor. I supported it when it came out a long time ago, or when we voted. I don't know the exact date that we put it into place here, but I supported it from the beginning. and I'll continue to support it. This is a local health emergency, as I feel. It is ramping up. There are things happening each day. There are different communities being affected. It's getting closer and closer. It seems like on a weekly basis, and I will be in support of the local health emergency until we work through this pandemic. All right, if there are no more comments, and I've been zoomed out too far to see Supervisor Crandall.
Yeah, no, sorry, I'll do it like this from now on.
No, whoever's controlling the camera in the boardroom is zoomed out so far.
I see. Yeah, now I see it. They're way in the
back of the room.
Yeah. No, I just wanted to say that I'm really glad we pulled it, just for the fact that it's important for the county to know and feel that we're discussing it before passing it, instead of just putting on the consent agenda. And certain times it's good to just have the vote and the discussion about it. So appreciate it being pulled.
There you go. Thank you very much, camera operator. Now I can see. Excellent. There you go. Supervisor Sabatier.
In fact, I know that in the past we've had conversations about moving these emergency proclamations out into the consent agenda, and I think it was because it was items that emergencies that we had finished as far as the physical emergency, but we hadn't finalized the insurance stuff, the paperwork stuff, the reimbursement stuff. I think if it's an active emergency that we're dealing with, that I think it should always be in our normal standard agenda and not our consent agenda, because that way it forces us to have a bit more of a discussion about why we're continuing it. Just my recommendation for future agenda items when this comes up.
Yeah. Well, as I said in the beginning of the consent agenda, it's usually non-controversial. I know that there are folks out there that are still questioning the data, questioning, if this is more than just the flu. But from and we can do that every time. But from my point of view, I've supported from the beginning. This is a very serious virus and epidemic that we're going through. Folks are getting sick. The numbers are going up. So when we talk about it being controversial or non-controversial, it shouldn't be controversial at this point. The data's there. The science is there. Should be moving through this with the effect that we've got to do everything we can to protect ourselves, our community, and our constituents in a simple motion. So we'll talk about that as far as agenda items. If it needs to be on here every 30 days so we can talk about it, that's fine. But the thought is non-controversial, and it should be non-controversial at this time because there is a public health emergency. There is a pandemic that is affecting the world and also our county.
That's what controversy
Okay,
is.
any
What
more
not
comments?
everybody agrees with that concept. Controversy is not always bad.
Okay, any more comments from the board? Okay, we'll open this up to public comment. Jake, I don't see any hands up. Can we, if we don't see no hands up, can we open up the room?
Yes, I will unmute the floor here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close it down. We'll bring it back to the boardroom. Is there anyone from the public in the boardroom that would like to make comment?
Nobody in the boardroom would like to make a comment.
Thank you very much. Okay, we'll go ahead and bring it back to the board for action.
Mr. Chair, I move to approve the continuation of local health emergency related to the 2019 coronavirus, also known as COVID-19, as proclaimed by the Lake County Public Health Officer.
Second.
Excellent. Seconded by Supervisor Scott. Go ahead and do the roll call vote.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
No.
And Supervisor Simon?
Yes.
Thank you.
Okay, thank you. Okay, now we're going to go to item 5.11. This was also pulled. This was pulled by Sheriff Martin. Go ahead and read the item. Approve agreement effective 5/1/2020 lowering the scale pricing, the reduction of the inmates due to COVID-19, and approve agreement effective 5/4/2020, increasing the cost per meal by 6 cents due to addition of one sandwich. And C, approve agreement effective 8/1/2020, extending the food service agreement with Trinity Services Group, Inc. to supervise the preparation and service of meals at the Lake County Jail Hill Road facility, and authorize the sheriff to sign the letter for the CPI increase. Sheriff Martin, go ahead.
Good morning. Thank you, Mr. Chair. So one change under item A, the approval of the issuance of approval of the agreement effective 5/1/2020. I brought this item to the Board of Supervisors as the contract between the food service provider is actually between the county and the vendor. And this was at the request of the vendor. Mark Cornifer, I don't know if he's joined the meeting. I notified him yesterday of this item being on the board agenda. This is the only topic on this consent agenda that there should be any discussion on. It should have read, discuss and consider approval of the agreement effective backdated to May 1st. Essentially what happened is this is the food service contract agreement that we have to provide meals at the Lake County Jail. They charge a per meal charge to cover their costs based on a sliding scale. The sliding scale that was presented during the original contract didn't take into consideration that we would ever be at a jail population as low as we have been as a result of COVID-19. And the request is to adjust those scales back to May 1st. This adjustment would mean about a $14,000 payment during the term of this contract. I'm not opposed to adjusting the scale. However, I do have a concern about adjusting it in the middle of the terms of the contract. To me, a more appropriate time would be at the time of the contract renewal, which is August 1st. So I hope that makes sense. The other two items are pretty non-controversial. During the coronavirus pandemic, we reduced the amount of hot meals that we served. So to make up for those calories that were lost as a result of hot meals, we started adding a sandwich at a cost of 6 cents per meal per sandwich. I support that amendment. And the final one, I would support the amendment to reflect the consumer price increase, which is actually written into the contract, and also to make those changes to the sliding scale for the inmate population to be effective August 1st. So I hope that's not too unclear. My only question for the board for discussion is the backdating of the sliding scale to May 1st. And if the vendor is on, he may, or the representative of the vendor may want to have comments as well.
Jake, can you say that name again, Brian, who we're looking for?
Yes, sir. Mark Hornifer.
Jake, do we have a Mark Hornifer in the room here?
I don't see him.
I do not see somebody by that name. Maybe they have joined through a phone.
No, we don't have a phone.
I don't see any phones either. Okay.
Oh, then all the phone drops. Yeah, I don't see someone by that.
Okay. Okay, well, we don't have a representative from, so go ahead, Supervisor Sabatier.
So just two questions. One is related to the 6 cents sandwich. I made an assumption while reading this, but since we're pulling it, I might as well ask it. There remains the nutritional value that is required of people who are getting fed at the jail with the 6 cent sandwich, because I can't help but think, what do you get in a 6 cent sandwich? Because that's a heck of a deal. So just kind of making sure the nutritional value remains the same.
I'm sure it's worth it. I agree, and I know the place where you can get a smoking deal, or Mr. Supervisor, but you probably wouldn't like it. So it has to do with the caloric intake requirements that Title 15 has for inmates. We had reduced the caloric intake that was provided by reducing that hot meal. The sandwich is intended to make up that caloric intake.
Okay. And that was my assumption as well, but I just thought I'd ask it. And then you're asking us because of the dates to change Part A, which is approve agreement effective 5/1/2020, to make that be also effective as of 8/1/2020. Is that correct?
The 8/1/2020 would be effective under Part C, so it would be redundant. So I guess the decision is, do we want to make an additional $14,000 payment to the vendor for an item that wasn't initially considered at the creation of the contract. My personal feeling is no, but the contract lies with the county and the board.
Okay, thank you for the clarification. Basically the same.
Okay. Supervisor Crandall or Supervisor Brown? Nothing? Okay. All right, if there are no more questions for the board, we're going to go ahead and open it up to the public. So I don't see any hands up on this item, Jake. I guess what we'll do is we'll open the room up again.
Okay, I will unmute the floor here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, thank you very much. Jake, go ahead and close the room and bring it back. We'll go ahead and open it up the boardroom. Supervisor Sabatier, are there anyone with their hand up for public comment on this item?
It does not look like anybody here is going to make a comment on this item.
Okay. All right, so we'll go ahead and close it and bring it back to the board for some more deliberation or action.
Supervisor, Chair Simon, I just had a question for the sheriff. So if we vote on this today, we'll be conducting the retro payment, or he's recommending that we pay it in August? Is that what I'm hearing correctly, Sheriff Martin?
I'm hearing he wants B and C.
Okay, got it.
Or advising B and C.
Okay.
Correct.
Okay, thank you very much for that clarification. All right, is there, bring it back to the board for action. Okay.
And just because I'm rereading this again, Sheriff Martin approved the agreement as of 5/4 for the introduction of the 6-cent sandwich, and that you're in full agreement.
That was a question for the sheriff?
Yes.
I wish you would phrase it differently. You're making me hungry.
Brian is, he's on mute, it looks like. Can't get off.
Here we go. I don't have the ability to unmute myself. Yes, that's correct. I would have, staff recommendation would be to deny item A and approve items B and C.
Okay, I just wanted to make sure because I hadn't re-seen that date there and just wanted to make sure we were still spot on. Okay, I will move to deny agreement effective 5/1/2020, lowering the scale price for the reduction of inmates due to COVID-19. And I'm going to make it all into one motion, and I'll let Ms. Grant stop me if I shouldn't. And approve agreement effective 5/4/2020, increasing the cost per meal by 6 cents due to addition of 1 sandwich. And approve agreement effective August 1st, 2020, extending the food services agreement with Trinity Services Group Incorporated to supervise the preparation and service of meals at the Lake County Jail / Hill Road facility, and authorize the sheriff to sign the letter for the CPI increase.
Second.
Excellent. And I don't see Anita's hand up, so I think that is acceptable to have that in one motion.
Unless you couldn't find the mute button.
There's been, a motion and a second. So Johanna, please give us a roll call vote.
Okay, Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Thank you, Sheriff Martin.
Thank you.
Okay, we will move on to our timed item, our 9:15 a.m. item, continuation or
Mr.
consideration
Chair,
of. Yes.
You do have one citizen that's been waiting for public input in the boardroom, I believe. So I just want your attention.
I apologize. I did skip over. So we're going to go to 6.1, our 9:01 a.m. public input item.
Thank you very much.
I wrote this to the Planning Commission, and I'm not sure if they ever saw it or not, 3 or 4 weeks ago. I sent this to the board last week, and it was not read. Mr. Simon said he had it. He's going to read it at 7.2, I think, but they must have forgot. But this is about the Butts Canyon project. I am against it because I do not want any other country owning land in California or anywhere in the United States, especially the Chinese.
Mr. Chair, with all due respect,
Supervisor Brown.
I'm not going to abide this. I mean, I'm all for free speech and all that, but this item is, and Anita can correct me if I'm wrong, but whether or not the Chinese own land in the United States is not an item that is under the board's jurisdiction, and I believe public input is for that purpose, but I may be wrong, and it wouldn't be the first time, probably won't be the last, but I just want to throw that out there. I'm not down with
Mr. Chair?
Yes, Anita.
Public input for this item does have to be on a matter that is within the jurisdiction of your board.
Okay.
Who buys property in the state of California is outside your jurisdiction.
Thank you very much, Mr. Raffinelli. I know that we did make it part of the public record. We did receive your information, but as you just heard from county council, obviously, at this time, like we said, we made it part of the public record, but at this time we're going to, move on from public input.
Okay. Thank you.
Thank you. Do we have any other public input?
Nothing in the boardroom.
Okay. Nothing in writing. Okay, thank you. Okay, moving along on the agenda items here, we're going to go ahead and go to, once again, item 6.3, our 9:15 a.m. item. And it is a consideration of a continuation of a local health emergency and order prohibiting the endangerment of the community through the unsafe removal, transportation, and disposal of fire debris for the Mendocino Complex fire.
Mr. Chair, I have a question for you, if I could, since we're all going to.
Yes.
We have folks here for the 10:30 item that have to get back to work. They're public, just quick proclamations, and I'm asking that we take those up because the other items, I think the folks are going to be here for a while anyway. Again, that's your call.
Oh, yes. Okay. Yeah, Dr. Pace, if you just be patient with us on this one, we will go to, if we want to get the proclamations out of the way, I'm willing to do that, obviously. Find what item.
So it'll be item 6.5, Mr. Chair?
Yes. Yeah, we'll go to item 6.5. I'm just getting here so I can read it real quick. Our 10:30 a.m. item, presentation of proclamation commending Lyle Thomas for his 26 years of service, for his 26-year career in public service for retirement today, and B, a presentation of a proclamation recognizing the Kelseyville High School K-Corps graduating class of 2020. So we'll go ahead and do the first proclamation, 10:30 a.m. item. And welcome, Lyle. Who's going to read the proclamation on this one?
So I have the proclamation right here in my hands.
I think EJ was going to.
I'll read it
if he could.
If Sheriff Martin doesn't have a copy of it.
Okay.
This is not the right one.
I have it right here on my computer.
All right, go ahead. We're going to go ahead and have EJ
Good.
Read the proclamation.
So, first off, thank you, Lyle, for your service. And I've known Lyle since I was a kid. He used to, before he worked for the Sheriff's Department, he used to work for Tribal Health, and he gave me rides to for tribal health as it came from my appointments.
Mr. Chair, we're not
Oh,
picking
here
up
we go.
the audio.
Sorry about that. I'll say that again. I said I've known
There you
Lyle-
go, EJ, yeah,
I've
excellent.
known Lyle all my life. Before he was part of the police force or the sheriff's department as a deputy, he worked for tribal health and gave me rides. He also helped me during a time when I was an adolescent. I was getting in trouble, and he was one of the people in my ear to tell me that I was making a good choice to join the Army. So Lyle, thank you for that. Board of Supervisors, County of Lake, State of California proclamation commending Lyle Thomas. Whereas Lyle Thomas began his career in law enforcement on May 23rd, 1994, working as a correctional officer for the Lake County Sheriff's Office. And whereas Lyle was selected in 1999 by the Lake County Sheriff's Office to attend a California Basic Police Academy, which he graduated from on September 3rd, 1999, and was promoted to the rank of Deputy Sheriff. And whereas on April 27, 2001, Lyle received his post-basic certificate. And whereas on January 17, 2003, Lyle completed a post-field training officer course and was subsequently assigned as a field training officer, training many deputy sheriff recruits over a span of many years. And whereas in 2007, Lyle accepted an assignment as the Clear Lake Oaks Community Service Deputy. And whereas on June 21st, 2009, Lyle accepted an assignment as a detective working in the Investigations Bureau. And whereas on February 1st, 2010, Lyle received his post-intermediate certificate. And whereas on April 18th, 2010, Lyle was reassigned back to the Patrol Division, where he remained until present day. And whereas after dedicating 26 years as a career law enforcement officer with the Lake County Sheriff's Office and the County of Lake, Lyle has demonstrated extraordinary dedication, compassion, and devotion to his profession and to his peers. His accolades include being a recipient of the Medal of Valor from the Lake County Sheriff's Office in 2007 for his actions in taking an armed suspect into custody, a recipient of the Medal of Valor for the Lake County District Attorney's Office in 2014 for his bravery in protecting a Lake County citizen during an officer-involved shooting, and receiving the Lake County Sheriff's Office Life-Saving Award for his actions during the 2015 Valley Fire. Lyle has trained many new deputies as a field training officer, passing on his knowledge and skills. He has earned the admiration, respect, friendship, and gratitude of his fellow employees and the county he honorably served. Now, therefore be it resolved that the Board of Supervisors of the County of Lake does hereby commend and express its deepest appreciation to Lyle Thomas for an extraordinary 26-year career in public service and wishes his success in all his future endeavors.
Yes, Officer, go ahead, Lyle, go ahead.
First of all, I'd like to give my gratitude to the Board of Supervisors of Lake County. Thank you for taking your time to bestow on me this awesome day. I have with me my wife, my son, and my granddaughter. I wasn't prepared to say anything, and I don't believe them, and I can't believe how emotional I'm getting over this, but it's been my honor to serve as a peace officer and serve the citizens of Lake County for 26 years. It's been my privilege to serve with the greatest men and women that I've ever been around, and I've been in the United States Marine Corps for 4 years. I forgot to offer that up. But the men and women of the Lake County Sheriff's Office are the most forthright, the most righteous, the most dedicated individuals that you'll ever meet, and I know that I've ever met and ever had the chance to serve with. Again, I'm a man of few words. I'd just like to say thank you, and God bless America.
Thank you, Lyle.
Probably can't hear it, but in the next room over in our conference room, there's quite a bit of applause from a lot of Lyle's peers, subordinates. And what I'll tell you about working with Lyle is this man epitomizes the spirit of community service. And he's passing it down through his son, who's also served with the sheriff's office and went on to serve in the military. Lyle has, for those of you that have known Lyle for a long time, you know that Lyle has some pretty unique abilities in speaking with people and summing people up. Lyle actually was one of my training officers when I came to the sheriff's office to get oriented. And he had a little bit of work to get me broken into law enforcement styles in Lake County as opposed to the central coast of California where I came from before. Lyle's got the ability to sum somebody up and know exactly how to talk to them to get the effective message across that needs to be done. If somebody needs to be spoken with firmly, Lyle's able to do that. Somebody needs to be spoken with some compassion, Lyle's able to do that. And Lyle has served as a role model for a lot of young deputies and a lot of old deputies over the years. He's going to be sorely missed. I know he said thank you to the Board of Supervisors, but the Board of Supervisors in Lake County owes him a debt of gratitude, and as do I. Thank you, Lyle, for being a great role model. Thank you, sir.
Thank you very much. I would just like to make a comment. Obviously, Lyle, thank you for your service to the community as a whole. But what I will say is you've been a role model to me my entire life. You've been a role model in the Native American community throughout Lake County. And as far as I'm concerned, you're a hero. And I just want to thank you so much for your service. And heck, man, even I'm getting emotional today because it's unbelievable that you spent the time here and done the job that you've done. So I just want to say thank you very much. And I'm proud to call you a friend. Thank you very much for your service. And once again, you're a hero of mine. So thank you.
Thank you, Mike.
Supervisor Brown.
Thank you. So there's not a lot left to be said about admiration that we all have for Lyle. I met Lyle when he first started at the jail in '94, and I think the jail was downtown then at the time, and the number, there's no way to count how the number of people who were trained and influenced in a way that they probably wouldn't have received from anyone else but Lyle. I actually had written down something here. The sheriff mentioned it, but it's the thing that impressed me the most about Lyle was his judge of character and judge of the person that he was dealing with, and then act accordingly on how that person needed to be dealt with. It wasn't there, you mentioned him giving you rides. He gave a lot of people rides, some of them to the jail. And he's very respectful. I heard that from so many people that he'd come in contact with that had so much respect for him, even if they were on the other side of the law at the time. I too consider you a friend. You're such a role model to not just your peers, but to your community. And your family should be very, very proud of you, just as we are.
Thank you, Rob.
Supervisor Sabatier.
Lyle, thank you very much for giving us 26 years of your career here to help our community be safer and just to provide the service that you've offered through Behind the Badge and also through your personality that you bring. I know some of your family, and I don't think it's a question of if they're proud of you. They are absolutely proud of you. You said that you are working alongside some of the most dedicated and loyal and righteous deputies and officers ever, but I think you need to understand that you've helped raise that bar for them to meet. So thank you so much for what you've done, and the best wishes for you in the future.
Thank you very much.
Okay. Any more comments, or I don't know if if the wife would like to say something. I see her standing.
Oh no, I'm just so proud of my husband for all that he has done to keep the community safe. I'm very proud. We love him so much. Now I could have a little bit of him more time. Very nice. Thank you.
Okay. Thank you very much. And Lyle, once again, thank you.
Thank you very much.
We'll go ahead to our second item on here, our 10:30 a.m. presentation of a proclamation recognizing Kelseyville High School K-Corp's graduating class of 2020.
Thank you, Mr. Chair. It's my honor. One of the things that without question, that I find the most gratifying in the last 20 years was to be able to get up the week before graduation each year and honor the students that have participated, been selected for the K-Corps group. K-Corps, for most of you know this, but for those that don't, K-Corps was founded, I think it was 1977. I ask you this every year. 77? First, 76. Okay. And it was started by a teacher who was also a reserve deputy who found that there was a need for search and rescue participants, some organized effort for search and rescue. And so he started this, and he actually just passed away this last year. Dick Arndt, he was one of our teachers. I was fortunate to be, I still can, to this day, can't figure out why, but I was one of the few that he selected for that, and so I was on the first year of when it first started, and it was an honor and something I've always appreciated still. But I love being able to honor the students. We have 3 of them here today, and I'm grateful that they were able to be here. It's unfortunate the others couldn't, but they're working, they're doing things, but I felt it important to recognize them publicly. And since this is the only forum that they'll get that recognition for now, I felt this was the best that we could offer them. So I have this proclamation, and I also want to make sure that we recognize and honor Mrs. Holt, Joni Holt, who's taken this thing over and run it for several years with help of others, but taking it to the next level. So I really appreciate that. So on behalf of the Board of Supervisors, it's my honor to recognize the Kelseyville High School K-Corps graduating class of 2020. Whereas Kelseyville Community Organization for Rescue and Public Service is a 2-year program in which the student is selected based on strict criterion and academic abilities. Whereas the students work directly with the Lake County Sheriff's Department and are on call for 2 years, 24 hours a day. And whereas the members demonstrate an ability to perform with a high degree of excellence and commitment. Whereas the senior members assist K-Corps teacher, Mrs. Holt, with training the junior members, and whereas all members must become trained in high-angle rope rescue, map and compass, GPS, search techniques, evidence search, and body recovery, and the members become certified first responders. And whereas these Kelseyville High School students have self-initiative and dedication that is outstanding. Now therefore be it proclaimed, be it resolved, that the Board of Supervisors of the County of Lake does hereby recognize the Kelseyville High School K-Corps, who are guided by their focus on the 3 Ps, prompt, prepared, polite, and strive to achieve academic and personal success for all students, passed and adopted this 14th day of July 2020. And so I'd like to read off the students that aren't here, but we will get those certificates to you. I'll make sure I get those to you. The first is Eduardo Sepulveda, Ryan Rigby, Augustine Ortega, Milena Mulder, Ali Mulder, Dylan McAdon, Jado Bonson, Bodie Baird, Giovanni Salguro, and the 3 that are here, and I've set your certificates over there on the table if you want to come up and get them. The first is Megan Miller.
And I'm hopeful we can get them on camera rather than just the back of their heads, if that's possible.
Maybe we could get them up here.
Yeah, because I'd love to get them recognized appropriately.
Yeah, if you could come over here by the microphone and then just stand there, and then we can get a photo of you too, maybe.
Yeah, right there.
There you go. Thank you. Spencer Odom. And Cheyenne Rivera.
There they are. Seem good.
And Joni, would you come up with and join them as well, and maybe we can. Yeah, thank you. Thank you. And I know the sheriff. I don't know if the sheriff is still on or not, but if anyone else had anything to say about that, about this particular group here. If not, then thank you guys. Thank you very much. If you'd like to say something too, Joni.
Yeah.
Yeah, right there.
So I just want to thank them for all their efforts. It's something that they're not required to do. It's something they just sign up to do as extra into their schedule. Most are working and playing sports while still maintaining, the extra study and the extra training. And, within community service hours and search hours, et cetera, they're putting in an extra, it could be up to 600 hours of community service in their time within KCOR. And so it's just, it takes a special person to be willing to, give up their time commitment like that as a teenager to go and serve others. And I just really appreciate their efforts.
You were at KCOR as a student.
I was at KCOR also, graduating class 85. So, yeah. So I'm proud of you. Thank you.
Yeah, see the sheriff.
I see Sheriff Martin has joined us again. Go ahead, Brian.
Yes, I got to wrap up some things with Deputy Thomas. Our search and rescue volunteers are probably the most professional volunteers you're likely to find anywhere. And these KCOR students that follow the tracks are some of the most dedicated students you're going to find anywhere. What a tremendous program. And the only reason that program is tremendous is because of the kids that participate in it. The dedication that they show and helping us out on everything. And this isn't just about, wearing an orange shirt. They go out and help us with missing person searches. They go out and help us with evidence searches. They go out and help us with search and rescue operations. I mean, what they do is far above and beyond just doing typical community service. It's really a level of devotion and commitment that is becoming quite rare these days. So I want to thank them for their willingness to serve their community and the sheriff's office and search and rescue. And I have no doubt that the kids that participate in these programs are going to go on to do great things. Thank you.
Thank you, Sheriff Martin.
This will be the last class that I get to recognize in this capacity. I'm proud of you guys.
Excellent. Well, Supervisor Brown, thank you for bringing this board, doing this all these years, but this will be something that we continue on. The future of Lake County is bright with kids like this, young folks that volunteer and go above and beyond. And I just want to congratulate them and thank them very much for their service to our community. And like I said, they will go on to do great things, like Brian said, for our local government here. Hopefully, our local communities. That's what I'm saying. All right, any other comments?
No, good job. Congratulations.
Okay.
Congratulations.
Thank you very much.
Thank you for your hard work and dedication and volunteerism.
Okay. Thank you, everyone. We'll go ahead and, we've been going for a little bit here. Do we need a comfort break or anything at this point? Okay, let's take I don't know if you guys waving or?
Yeah, I'll take one. Yeah.
I could use more coffee.
Okay, let's take a 5-minute break here, and then we'll come back to item 6.3. Work through the rest of these items. All right. We're going to go ahead and move to our 6.3 item, our 9:15 a.m. item. Consideration of a continuation of a local health emergency and order prohibiting the endangerment of the community through the unsafe removal and transportation and disposal of the fire debris for the Mendocino Complex fire. Dr. Pace?
Good morning again. So basically, this is an extension of the emergency order that is meant to allow us to complete the cleanup from the previous fire. There's 22 properties out deep in the forest that have been needing to get cleaned up and have been postponed for various reasons. The state cleanup is supposed to be happening. We, at the last time we mentioned this, it was right before the governor's budget was going to be approved, and they did approve the budget and the money remained in the budget. So the money is still there to do this. Jazzjit, our environmental health director, has been in touch with the state, and they are in the process of planning on moving forward, they claim. And so we're basically just in the process of trying to arrange all that to happen. So we just asked to continue this emergency declaration so we can go ahead and complete the cleanup.
Okay, any questions from the board? Supervisor Crandall?
Oh, no.
Okay. All right, if there's no more, no questions or concerns from the board, we'll go ahead and, or comments, we'll go ahead and open this up to public comment. I don't see any hands up, Jake, so can you open up the room?
All right, I will unmute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, hearing none, go ahead and close it down. We'll bring it back to the boardroom. Do we have anyone in the boardroom that'd like to make a public comment on this item, on item 6.3?
It does not appear, Mr. Chair, that we have anybody in the boardroom willing to make a comment on this. Did you only hear the last part? Yeah. Does not appear that anybody in the boardroom is going to be making a comment on this.
Okay. All right, we'll go ahead and close public comment and bring it back to the board for action.
Go ahead. My pad died.
That's too bad. 1 second, and I will bring it up. Mr. Chair, I move to, I'm getting there, approve the continuation of local health emergency and order prohibiting the endangerment of the community through the unsafe removal, transportation, and disposal of fire debris for Mendocino Complex Fire.
Second.
Seconded by Supervisor Crandall. Yep. Johanna, would you please give us a roll call vote?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Okay, thank you. Okay, moving to our 6.4 item, our 9:30 a.m. item. It's a public hearing from Community Development Block Grant Economic Development Program presentation and consideration of a resolution approving application for funding and the execution of the grant agreements and any amendments from the 2019-2020 funding year of the state CDBG program. Administrative Officer, go ahead, Carol.
Thank you, Mr. Chair. Thank you. Assistant CAO Susan Parker is going to introduce this item, and then our consultant, Jeff Lucas, is going to present to your board. So Susan, please go ahead. Susan, you are on mute.
Good morning, board. The purpose of this Community Development Block Grant presentation is to inform your board and the community about the opportunity to apply for 2 CDBG program grants. They are a business loan program for $500,000 and a micro enterprise program for $250,000. Jeff Lucas with Community Development Services will present more details and answer any questions you may have before your board considers the resolution that is required by the California Department of Housing and Community Development to be eligible to apply for these grants. Jeff, if you would, thank you.
Hi, thank you. County staff has asked that we provide a brief background on the CDBG program and then discuss the application for your consideration for submittal to Housing and Community Development. So on the CDBG block grant program, we can provide services through that program that principally benefit low, moderate household incomes, and we can mitigate slums and blight with that program, and we can also meet urgent need under the federal law. However, the state frowns upon using these funds for that purpose. This year, we're eligible to apply for $3 million if under the Notice of Funding Availability for January 2020. The funds can be used for community development programs and projects and planning and technical assistance, as well as projects like the Anderson Springs sewer system project, as well as the Cobb water system improvement projects that are undergoing right now up on Cobb. So those are the infrastructure projects as well as programs that can be done with these funds, as long as they benefit low, moderate household income folks. Today, what we are recommending for the board's consideration and approval is an application and funds due to the impacts of COVID-19 on our local businesses. We've seen a great deal of them suffering from the closures. And so we're recommending that the board submit an application to HCD for CDBG funds, the amount of $250,000 to provide technical assistance and guidance to small businesses. And small businesses are defined as businesses with 5 employees or less. And that we're going to focus on access to capital, marketing their businesses as best they can. And then the other application activity will be in the amount of $500,000, and that is to provide low interest loan funds for businesses to help retain jobs as well as create them. We've worked with staff at the state on these programs, and they are they've modified their rules a little bit to help everybody with the responding to the COVID-19 closures. And we've done all we can working with our banks as well so that they will participate in the program and let us know of businesses that are going to need this kind of technical assistance as well as the financing. It's an unusual situation for us to be in right now. Hopefully this will help some of our local businesses stay in business, and when we get through this COVID-19 situation, put them in a better position to expand and create more jobs.
Okay, thank you very much, Jeff. Thank you very much, Susan. Okay, questions or comments from the board? Supervisor Sabatier?
Thank you very much, and thank you to staff for bringing this CDBG opportunity to us. Just to clarify, and I have further questions after the fact, you said $250,000 and then another $500,000. Is that breakdown in section 1 of our resolution? The
yes.
232,500 plus the 17,500 is equal to the 250, and then the rest is equal to the 500?
Yes.
Okay, I just wanted to make sure that that was the correct breakdown so that as we're looking at this, it makes sense because the 250 was not directly there. You also said and mentioned that there's up to $3 million that's available for us. And obviously we're limited in capacity for what we can bring in and how we can make sure that we expense of it. But I do see an opportunity for rehabilitation of housing. In our housing element, it oftentimes talks about the age of our housing infrastructure, the quality of our housing infrastructure. And in certain areas, it's more of an issue than other areas. But I would love to see us also trying to obtain funds to help with the rehabilitation of housing. I've been working hard with the city of Clear Lake. I've worked with Supervisor Crandall to try and get developers to take interest in building homes here in this county. And it's a difficult task. And so building something new is difficult, but rehabilitating something that's already there is also absolutely necessary. So I'd like to get a little bit more information as to why we're not obtaining some of those funds that are available for that. Because in my mind, it's something that we have an opportunity to use that for, especially right now. There's also, and I'm kind of going into left field here, but there's Project Home Key, the second step of Project Room Key, which is to purchase properties, rehab those properties, and help get our homeless population into homes. And I just see that all of that put together, we can really make a difference in some of these communities that do have a lot of dilapidation and blight. And so I'd like to understand better why we are not going for the full Monty.
Well,
excuse me, Jeff, this is, I can speak.
Go ahead, Susan.
Oh, I'm sorry. Thank you, Moak. Right now, as you may recall, we came before the board to adopt our draft housing element and are in the process over the next 90 days to complete it and have it certified by the state. Once that's completed, then we will be eligible to apply because they use the the certified housing element to determine eligibility for the program. So it's not off the radar. We just have to do this one step before we can even consider it.
Okay, I hadn't thought about the chronological order, and I'm sure that some of the housing elements that I had reviewed will not get any better because of the status of our housing development that we've had in the past years, which would make us absolutely eligible for those funds. So thank you very much.
You're more than welcome.
And we won't miss the window by waiting for the housing element to be completed. That window is large enough for us to still have access to the rest of those funds for rehab?
We believe so.
Yeah, and I see Jeff had his hand up also. I don't know if you had a separate comment, Jeff?
Yes, thank you. Susan's right. The application process runs year long now, so there should be funds available for us to pursue the housing rehab work later in the year.
Okay.
All right, thank you very much. Any more questions from the board? Supervisor Crandall?
I just had a comment. I just wanted to discuss or just state that I talked with Jeff and Andy about this, and I think it's a good opportunity. I like the idea that we'll be working on helping with like technical assistance so that people have outside of the box thinking when it comes to marketing their business, things like that. I really like seeing the mitigating slums and blight because, of course, in my district that's usually a consistent problem, and so anything that can add to taking away from that problem is a good thing. So, thank you, gentlemen.
Excellent. All right, any more questions or comments? Supervisor Brown?
Yeah, Jeff, with regard to the project up at Cobb, this addresses part of that as far as getting the funds available. Is that right?
This particular resolution, Supervisor Brown, is for a new application to submit funds for a different purpose. We are working on that question you just asked in regards to getting the subrecipient agreement completed. And my understanding from county staff is that will be before your board for approval at the next board meeting. And Susan may have some additional information on that.
I heard you mention that particular project, and I couldn't see anything in here, so that's why I was asking.
Yeah, I'm sorry. I was referencing that as an example.
Got it. Okay.
Of CDBG funded project that was used for infrastructure improvements.
The timing of it is so close. I thought, well, maybe I'm missing something here as far as the funding for that, but I got it now. I see what you're saying. And that's supposed to be on the agenda for next Tuesday. I know it's not on the agenda right now, but I know there are people up there waiting to get paid, so there is a connection.
Thank you.
Okay, any more comments or questions from the board? Supervisor Scott?
Just a comment that this is perfect timing to help our businesses out. I know we have so many that are struggling, and just being able to have some funding to think outside the box, maybe looking at getting online, doing things differently. So I'm excited to move this forward to help our small businesses here in Lake County.
Excellent. Supervisor Sabatier?
Thank you very much. I was thinking about the amount that we're getting, and I appreciate whatever amount we can get that we don't have. It's money that we're bringing in and not money that we're using that's already here. But when it comes down to it, when you think about it, the amount of money compared to the number of businesses that might be looking for some assistance is very slim. So number one, what kind of are there opportunities where we as a board can look at maybe supplementing this amount to make it a larger amount? And number two, who chooses which business gets this money? What is the process by which we go through? Because it's going to be very limited. And not to say that we would have a similar situation, but I don't want this to be another PPP debacle where specific agencies get it and others who really need it get left out hanging to dry. So I just want to check in on what our process will be. And if that will be coming back to the board. And I know this has nothing to do with the resolution, but it's just a future question on, once we have access to these funds, what is our process for divvying it up?
So, in response to your first question, this is the maximum we can apply for. Well, there's 3 million available for all their programs. We can only apply we apply for the total amount that we can get under this program for these specific activities. So in answering your first question, your second question has to do with the process and getting the word out. We're going to work with our banks, with the Chamber of Commerce, with the Economic Development Corporation, and we will be posting the information on how to access the funds. And there's a loan application process that we go through. We'll also be making presentations and we'll have webinars on accessing these funds. But there's a process that we go through to make sure that the business is eligible for the funds, that they're going to retain the jobs, they're going to cash flow adequately as best we can figure given the current situation, so that the funds are actually paid back when they're creating a job. And in some cases we may forgive the loan if they perform properly. So there's a whole series, and in the narrative, and I'd be happy to send to you the application process and the guidelines for the program.
That would be great. Thank you.
Okay. All right, any more questions or comments from the board? Okay, seeing none, we're going to go ahead and open this up for public comment. And I see we already have a hand up in the room, so Jessica Peisel.
I have sent you a mute request there, Jessica. Looks like you're on mute. Will you just confirm your first and last name?
Yes, Jessica Peiska. I'm with the Cauberry Council. I just wanted to speak to my conversations and my experience with local business owners through strategic planning sessions. This opportunity will really help fortify them through these difficult times and give the resources that they really need in technical assistance. Supervisor Sabatier, we have a supplemental program. The Cauberry Council Loan Program has been expanded for all of Lake County. So we have that program that you can access through Jeff Lucas. I also look forward to the housing element being complete so we can get to work on the housing rehab projects that are so desperately needed in our county. Thanks so much.
Thank you, Jessica. Okay, Jake, do you see any other? I don't see, that's the only hand I see up at this point. So we'll go ahead and open up the room, Jake?
Yeah, I could open up the room here.
Okay.
The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, we'll go ahead and close it up and bring it back to the boardroom. Is there anyone in the boardroom that would like to make comment on this item?
It does not appear that there are any comments here from the public.
Okay. All right, thank you very much. And we'll go ahead and close public hearing and we'll bring it back to the board for action. And the action is offering the resolution, I think.
Mr. Chair, I offer the resolution.
Okay, Johanna.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Aye.
Supervisor Brown?
Oh, Yeah, I said aye and my mic's on, so I don't know what else.
Oh, okay.
Yeah.
And then Supervisor Simon.
Yes.
Thank you.
Yeah, that's pretty good.
Okay, thank you, Susan. Thank you, Jeff.
Thank you, sir.
Thank you.
Board.
Leave.
Okay, that concludes our timed items. We're going to go ahead and move to our untimed items. We're going to, or non-timed items. We're going to go ahead and start with item 7. I apologize, lost my page here again. Okay, we'll go ahead and start with item 7.3. Consideration of update to return to work protocol. Am I on mute or something?
No,
Hello?
I heard you.
No, we can hear you.
Okay.
Sorry, Mr. Chair, I had trouble getting my own mute button undone.
Okay.
Sorry about that. So as you know, you first approved the COVID-19 return to work protocol for county employees and county offices on May 19th. And at the time you approved it, you directed that we return to you every 30 days for a review of the protocol. Your first 30-day review happened on June 16th. And at that time, the changes we made were primarily to clarifying that it is the employee's responsibility to make their own decision about testing if they believe they have been exposed to the virus. And an employee that believes he or she has been needs to self-isolate for 14 days, and the self-isolation period could be reduced if the person has a negative test result or a doctor releases them to return to work. So that's what we did back in June. And what's before you today are a couple of additional changes, actually additions. First of all, we're proposing to put a table of contents in this document just to make it easier for employees to find what they need. But most importantly, on page 5, you'll see that we've added a section about what to do if an employee tests positive or an employee resides with an individual who tests positive. And so it provides some instructions there on how departments should manage those situations, what they can and cannot disclose to other employees, and then, of course, the requirement for sanitizing the workplace. And so we're recommending the addition of that language based on the questions we're getting from departments. There have been a fair number of situations where departments are asking the questions that we're attempting to address here because they do have employees that believe they have been exposed. And so this policy, or this additional section to the protocol has been sent to the department heads for review and adjusted somewhat based on their comments. I believe it is good for now. And just this morning, our county safety officer, Jeff Ryan, requested another minor change to a different section that you don't see before you, but I'm going to do a quick share screen if that's okay. So if you can see that, Mr. Chair, is that visible to you?
Yes.
Okay, so this pertains to the section on page 2. It's the second full paragraph under the section called COVID-19 Workplace Protections. And the county safety officer is requesting that we add the language that you see there in red, just to make sure that all employees understand the importance of masking and social distancing when in the workplace. So I'm sorry that came to me just this morning and I couldn't put it in this draft, but that sums up the changes we're recommending to the protocol now. And then we will be back to your board the second Tuesday in August to take another look and to bring forward any update that we recommend based on the needs of departments.
Okay, Carol, thank you very much. If you could take that down at this point.
Yes, sir. Thank you.
Actually, can we keep that up? Because I have a comment specifically about that.
Yes, just a second. There you go.
So if
Go
I
ahead,
may-
Supervisor Sabatier. At this point, I can't see anybody, so make sure to speak out or raise your hand there. I can see the folks in the boardroom. Go ahead.
So I'll keep this short so we can get back to the normal view on Zoom. So I appreciate that this is brought to light here, because what I read on there is what we're attempting to practice in our offices, but at the same time, it does not match what our county mandate is for masking. The county mandate for masking is you must wear a mask at all times when you're indoors in a place of business. If you look at the state one, that is what we're following, because the state says you must wear a mask at all times, but then there's also kind of a contradictory later on that says unless if you can't social distance, you must wear a mask, meaning in reverse, if you can social distance, you don't have to wear a mask. So I think we have so many different things moving. We got the state moving, we got the county moving, we got our internal work protocol moving, and they're not all necessarily aligning. My opinion, and I know it's not on the agenda right now, but my opinion is we just need to go either with the state or we need to go with what the county is saying as far as their masking order, because we are not matching our behavior, nor it would seem, based on what I'm reading right here, our protocols to what our county is saying as far as the mandate. And so I think this creates a lot of confusion in our communities. It creates a lot of confusion in some of the emails that we receive about complaints about businesses. And we are making it more confusing ourselves in the way that we are acting. And so I think that we need to clarify that. Are we following the state mandate? Are we following the county mandate? And internally, we shouldn't have to choose one or the other. Because as far as I'm concerned, unless I've read it wrong, our county one says, indoors, you must wear a mask. And I prefer, if we're social distancing, that you shouldn't have to be forced to wear a mask. I'm sure others would probably disagree, but I think we have to ask for the bare minimum and not ask for everything that has to happen in order for us to be safe. It's just, it's asking a lot from our workers, other workers out there. I think as long as we're getting the social distancing part, then I think that puts us in a better place. If you're not, put on a mask. So I'd like to hear from Dr. Pace to see if I'm correct in the contradiction in what I'm reading, because I'd like for us to be on the same page.
So, Mr. Chair, could I respond in terms of the evolution of this policy, this protocol, and why this language looks like it is? And if Supervisor Sabatier is suggesting we replace this section with something more direct, staff would be very happy to do that. So this language should look familiar to you because it's what evolved from your board back when the county had a masking order. That masking order was rescinded when the governor's order took precedence, and unfortunately this policy we didn't update that at that time. But if your board would prefer that this section be replaced with language that essentially says the content of the governor's order, that masking is required at all times indoors, we're happy to make those revisions. The reason for the additional language you hear today, or you see before you today in the red, is because there are a fair amount of complaints and concerns expressed that masking isn't taking place as consistently as it should be in our workplaces. And so I really appreciate Supervisor Sabatier's comments. They're right on, and this language, again, I just wanted you to understand the history of it, and if you'd like to see it updated, we'll do that.
And if I may respond to that?
Go ahead, Supervisor Sabatier.
I know that we had, again, this is maybe my own confusion, but I think that when we do so many different ordinances and changes that it gets confusing, we had made an ordinance how behavior in our government offices would be. We rescinded that. We didn't rescind the masking mandate for the community. I think that because we had a masking mandate within our community overall, we rescinded the one that we had created for the courthouse and our government offices. So I don't think we ever rescinded, in my opinion, I don't think we ever rescinded our county-wide masking mandate. And maybe I am the one that's confused.
You're on mute, Moak.
You can take this down, it would help me out greatly. So let's see if Dr. Pace is still in the room. Can't see that at this point, so. Anyway, it looks like Dr. Pace has left his office.
He's left the building.
Mr. Chair, what I would suggest, if you would, for today is to please consider adopting the changes to the protocol as written, and then give me this week to confer with Dr. Pace and come up with a rewrite of this other section that's about the masking and to clear up that confusion. And I'll have it back on your agenda next week to fix that as well.
Okay.
But I think to delay all of it might be problematic for departments because they are asking a lot of questions about what to do if an employee believes they've been exposed or, those sorts of questions are coming up.
Okay. Yeah, so what I would do is obviously ask the board if we could move forward in that manner to get something completed and then bring it back forward. These are going to be changing each week. Who knows what happens between now and 7 days from now at this point. So go ahead, Supervisor Sabatier.
So I did have some other changes that I was looking at. I think that this section that we're changing doesn't read necessarily correctly. So I'm looking at where it says employee tests positive with the parentheses or resides with person who tests positive. I think we need to get rid of or resides with person who tests positive or who has had close contact with a person who tests positive, because that doesn't have to be somebody that you reside with. And so if you went out of town and suddenly that person is COVID positive, well, then it shouldn't just be if you reside with somebody. And so I think that we need to be a little bit more broad of a brush stroke than just if you're positive or if somebody in your household is positive. Because we're looking
That's a very easy fix. Thank you.
We're looking at the contact. And let me see the rest of my notes. And then if we do the second contact, the second bullet point of do not disclose the identity of any employee or any household member, maybe change that household member to or other close contact of anybody who tested positive for COVID-19. That's going to have to be changed somehow or another. I have a strange question, and it's going to upset a lot of people, but at the same time, this is the reality of how workers' comp works, right? If somebody gets hurt, a lot of times they'll be drug tested, and if they're positive, then that's not good for the situation, and workers' comp may or may not be activated. We're asking people through a mandate that they must mask if they're not doing 6-foot distancing, and we're saying here, if you didn't mask and didn't social distance, that you can go, that you would go through the process of workers' comp. How does that work when you're not following the rules that we're asking you to follow, which could be similar to the drug test situation of we need you to be drug free, you're driving a vehicle, you had an accident, and now we're testing you. Because again, just asking for, we need people to take responsibility for their own actions, and workers' comp is a responsibility that the county has to take for the lack of action from certain employees, and just kind of checking in to see how that would work.
Mr. Chair, I could probably help with that.
Okay, Anita, go ahead.
Well, actually, there's the operation now of essentially a presumption under the law. It's rebuttable, but it's still a presumption under the law if you're in office buildings with COVID. But I can tell you that the fact someone doesn't follow the rules that the county lays out might subject them to disciplinary action, but it will not impact their claim. We've had employees who have walked right into a marked off area that says do not walk here, dangerous area. They walked right there and fell down. California workers' comp still pays for that. So that's a much more involved question, though a good one. But all of these things in terms of training within departments, staff meetings, whatever, to ensure that people know the rules is the best way to reduce workers' comp claims. If they claim they don't know them or know them and violate them, it still could be a bona fide workers' comp claim.
Okay, I appreciate that comment. And then my last comment is the last bullet point of that whole section that's highlighted. The second sentence starts with the word leaning, and that needs to be changed to cleaning. Just my last comment.
Okay, any more questions or comments from the board?
I do.
Supervisor Crandall?
Yes, and I don't know if this pertains to us per se, but the folks that do the security, who would we talk to in a situation to get them protection or anything like that? Is that the courts or is that us? I mean, it's a common question that I know I've heard before, but.
Yes, Supervisor Crandall, they report to the courts, and I do communicate now and then with the court executive officer regarding the security guards.
I'll talk to you offline then. Okay.
Thank you, Supervisor Crandall. Any more questions or comments on the return to work protocol from the board?
Mr. Chair, before you move on and open it up to the public, I would appreciate being able to go over the changes Supervisor Sabatier requested to make sure I've got it right. So is that okay with you?
Yes.
I did have one more before that happens, and I wish I could find it off the top of my head. I know I read it, and I unfortunately didn't have it in my notes, but it said something of because you can get tested within 24 hours, that getting tested at a Verily site is not a problem. And I can't do a search on this document, so I can't quickly find that part, but that is no longer the case, and I'm not sure if that changes anything else. I don't think that should change the entire derail this conversation, but just something to look for as we keep updating it, because I think that is no longer the case and therefore not something that's usable as we keep moving forward.
Thank you. So the changes that have been recommended are, well, first of all, that we'll come back next week, recommended changes to the section on page 2, which is the COVID workplace protections section. But on page 5, the highlighted section relating to when an employee tests positive, we're going to change the phrase that says or resides with a person who tests positive to has had close contact with a person who tests positive. And then the second bullet of that same section, it would read, do not disclose the identity of any employee or of any close contact of any employee who tested positive. And I believe that addresses that. And then on the next page, the last bullet, same section, the word leaning revised to cleaning.
Okay. Supervisor Sabatier.
And I just wanted to bring attention to the specifics. It's under, on page 5 of the document itself, under employee, come back. Employee exposure and testing. It has an and or section, and on the or it says contact public health's Verily mobile test to make arrangement for testing. And then a couple paragraphs below that, before the project baseline link, it says for Verily, testing is typically done the next business day, and employees can complete a screening form and schedule testing by accessing this link. And that link, I could promise you right now, it is not the next day, it will be next week. So again, just I wanted to point that exact location. I don't know exactly how that needs to change, but wanted to bring it to administration's attention.
Then maybe I would suggest that we just remove the whole phrase about if testing is typically done the next business day and have it say for verily testing employees can complete a screening form and schedule testing by accessing this link.
Yeah.
And of course, that'll all have to change too at the end of August. When Verily is no longer the provider, so.
Right.
Okay, any more comments or suggestions on the return to work protocol? Seeing none, we'll go ahead and open it up to public comment. And I see we already have one hand up. We have, I think it is, I'll assume it's Michael Green, but go ahead, Michael.
Yes, thank you. Just a couple of technical points. So to Supervisor Sabatier's noting there is some conflicting language. I did look up, we do default to the state order right now. The language that was proposed to be added that was highlighted in red in particular as it applies to hallways and restrooms. I'm reading the state guidance right now, and that language fully complies with the existing state masking order, and there are some additional guidance in there, but a workplace policy is kind of a county-specific form of guidance where you mainly have office settings, and so some of the stuff you're going to put in your workplace policy is going to riff off not just the statewide masking order, but also some of that industry-specific guidance for like office settings and what have you. So I just wanted to say I did look it up. It is a little confusing, but from what I can see, the proposed change in that language is fully compliant with the existing statewide order. My ears perked up on the reference to the Verily testing. So if you have an employee test positive, I don't know if the county has a separate contract with Verily, but if the idea is that they're going to get in line with everyone else to get a test at these public sites, I don't think that's the best mousetrap. Typically, you're going to get your quicker turnaround in terms of testing by contacting your doctor and using the testing resources that are offered by the health systems and not just kicking them out to the public system, the Verily system. I can tell you I had my last Verily test June 25th. I'm still waiting for my results. So I don't think it's fair necessarily to say you have if you're just kicking them to Verily for testing, you're not really doing much. You need to get them into a medical provider that can access a different testing stream. Thank you.
Thank you for your comments, Michael. Okay, I don't see any other hands up, Jake. Can we open up the room, please?
Yes, I will open up the floor here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
If we have anyone in the room that'd like to make comment on this item, please do so now. Okay, Jake, we'll bring it back. We'll close the room up and we'll bring it back to the boardroom. Do we have anyone that'd like to make comment that is in the boardroom?
Mr. Chair, it does not appear that anybody is going to be making a comment.
Okay, thank you. Okay, we'll go ahead and close public comment and bring it back to the board. Supervisor Sabatier?
So I appreciate the comments from Mr. Green. I would like to get a full response from Dr. Pace prior to moving forward as to what is our current status with the mandate masking order. Is it a county order? Is it a state order? Because our county order seems to be, if it's the county order, it seems to be more restrictive than the state. And I don't want to approve a policy, even in our own workforce, that is less restrictive than the state, because that would not be allowed. And so I'd like to get that response, since I don't have any proof that we are defaulting, other than I can say in the last press release, it was linked directly to the California Department of Public Health for the guidelines for masking, but I don't remember seeing any order that canceled our order. And so I just want to make sure that we are following whatever order is still currently active and to resolve that confusion. And real quick also, maybe just get rid of Verily. Just don't even say Verily. Contact public health to make arrangements for testing. And that way we're set for August and we're set for now. Right now we have Verily. In August we might have something else, who knows? But maybe just get rid of the word Verily altogether.
All right, is there a consensus of the board to just get rid of the Verily language at this point in the document?
Yeah, I'm okay with it, and the reason why I was hoping that Dr. Pace would be on for this, but I wanted to ask him if we could start having discussions, and I think we'll have it either in the COVID recovery meeting or something else, but of negotiating with different entities to conduct tests that are outside the realm of being an emergency, because that's where some of the problems come from. When people get sick, sometimes they're not sick, but they want to know if they have COVID, and they have to wait for the Verily site, and that's the only place. So I'm in agreement with that.
Okay, do we have?
Okay, Mr. Chair, so noted. We'll delete all references to Verily.
Okay, contacting the public health to set up a test. Dr. Pace, I know you're still on there, but I haven't seen you in the room for a minute, so I didn't know if you're on another call, but if you could chime in, I'd greatly appreciate it, or at least get a hold of Supervisor Sabatier. He's on there, but I don't see him coming into the room. So for clarification on that, you know, there are a lot of changes and things that have been gone around, but from my recollection, I thought that we had moved towards just being in line with the state orders in the mandates. But Dr. Pace, or even if Denise is on the line, maybe Denise Pomeroy could make a comment. But I don't know if you're going to get that answer right now, Supervisor Sabatier.
So, Mr. Chair, I'll make sure the answer is obvious when we come back next week with the revised language that will be based on what Supervisor Sabatier has asked.
Okay. All right, so we'll bring back to the board for action. Is anyone going to make a motion to help move forward with this?
So I'm going to attempt to make sure that I feel comfortable with the motion. I move to approve the update to return to work protocol with amended changes and the checking in. Oh, could we pause and get the answer?
Yep, I see Dr. Pace is back in the room. So Dr. Pace, there was a question. Go ahead, Supervisor Sabatier.
Dr. Pace, thank you for coming back. Wondering, are we still acting on our county mask mandate, or did we abandon our mask mandate and are just following state mandate? Because they're slightly different.
State order right now, yeah.
We're following the state order?
Right. Yep. So at this point, with virtually all the orders, we're just following the state orders.
Because the last time I heard us saying we're aligning with the state was on May 21st or before May 21st when we did our attestation. And in our attestation is when we created the mask order prior to the state making a mask order. And I don't remember any specific order that rescinded our order. And so if there's absolute proof that we've said so, then we would be with the state. But I looked at all the press releases and all the orders that we've signed, and I have not seen anything that negates C20-6, which is our ordinance that was passed creating the masking mandate for the county.
Well, yeah, I'm not sure. We'll have to go research that, because the intention has been to basically align with the state orders. So that may have been, there was a lot of moving parts, so I may have missed that. So.
And do you agree with the state order that if you are able to socially distance with 6 feet of space at minimum, that masking is not mandatory indoors?
Is that what the order says?
Oh, the order of the state says that you must wear a mask even if you're alone, and then in a public place, and then further down, maybe 2 or 3 bullet points, it says that in a room, even where the public goes, if you're able to, you must wear a mask if you're unable to socially distance, which could be taken as if you can socially distance, you don't have to wear a mask. I think.
Yeah, I mean, I think that's basically what we were doing as well. It's been a little while since I've looked at the specifics, but that's essentially what we did, because there was a point when I was requiring a medical exemption if people didn't do that, and then we decided to just let go of that and go to, you had to keep the social distancing if you were inside. So I think that's the same as so I would agree with that, yes.
Okay, I appreciate the conversation, because I think that helps all of us as supervisors dealing with the complaints that we receive, because I think people are expecting very stringent 100% must mask in all situations, rather than if you're not able to socially distance, then that's when you must mask.
Sorry.
So Dr. Pace, you missed the earlier part of this discussion. I think we're talking about the county's return to work protocol, and I'll follow up with you because the great point that still pertains really to this issue is that section of the policy, the protocol, is a couple months old, and we need to relook at that and make sure that it is, as up to date as it should be. So we'll review that. I promise the supervisors will come back next week with a review of that section only.
Yeah, I apologize. I was on another call with the schools, and so I didn't realize we were getting to something where you needed me. Sorry about that.
No worries. I appreciate you coming back. If there's no further comments, I will continue my motion to move to approve the update to return to work protocol with stated amendments by Ms. Hutchinson.
Second.
Is there a second? Seconded by Supervisor Scott. So we'll go ahead and do a roll call vote.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
All right, thank you very much. Okay, we're going to move to our 7.4 item, discussion and consideration of next steps for filling the special district's administrator position upon the retirement of the incumbent. CAO.
Thank you, Mr. Chair. As you know, Jan Coppinger, our special districts administrator, has notified your board that her retirement is impending. Her last day with the county will be December 1st, 2020, upon which date she plans to retire. She's given us lots of notice, so your board can take whatever steps you deem appropriate to recruit and hire a new special districts administrator. And the purpose of this agenda item is for me to seek your guidance on how you want to proceed with that. Your normal protocol is to have the Human Resources Department open a recruitment that would, be published nationwide. And I just wanted to check in with you and ask you if that's what you would like to do in this case.
Okay, bring it back. Go ahead, board. Any comments at this point?
I'm a yes.
I'm a yes also.
Pretty simple.
Supervisor Sabatier?
I'm an absolute yes, and I don't know, Ms. Grant would tell us if this is appropriate, but maybe having a final evaluation with the Director of Special Districts so we can get a better understanding of the current status and the current needs of the department to move forward.
Well, you can talk about it as it relates to job performance. If you want to have a conversation about needs of the department, of course, that would be an open session.
Okay.
Okay.
But the answer is yes for that.
For job performance, yes, absolutely.
Sorry, Anita. Supervisor Scott?
I'm also a yes, but I just know that this is going to be incredibly difficult to find somebody to replace all the amazing work that Jan has done with all the grant funding and everything, all the projects that she has provided the county.
And I'm a yes too. I'm a yes as well. And again, working with Jan is great. She's willing to attack any issue, well, not attack, but deal with any issue, whether it's hard. She's willing to have those hard conversations, and so hopefully we find someone that can fill those shoes.
You should have said.
Okay, supervisors, we'll get that rolling ASAP. Thank you.
Anybody that gets it.
Okay, is there, all right, any more questions from the board? Seeing none, we'll go ahead and open it up for public comment. Jake, I don't see any. If you could open up the room.
Yeah, there's no hands up, so I will mute the floor here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close the room up and bring it back.
All right.
We'll go ahead and bring it back to the boardroom. And I can't see the boardroom, Bruno. You can let me know if anyone is still sitting in there.
I do not believe that anybody is getting up for a comment on this item.
Okay, all right, thank you very much. Okay, I know as we move forward on the agenda here, we have our 1 o'clock workshop, and I know we have a few more items we need to get finished before we go to closed session. I'd like to just get the feeling of the board of we'll get potentially some of our employees and folks a little bit of a break starting at 12:30 and then come back at 1 to continue with the workshops and finish out our agenda. I think, we need to, like I said, let some folks get out there and get something for lunch. So what I would like to do is go ahead and take a break from 12:30 to 1 o'clock, and then we'll come back with the workshop and then finish our agenda items that we still have left on the board here on our agenda.
That works for me.
Okay. All right, well, we still have a couple of minutes, so can we do our calendars real quick? And then we'll break for lunch. So go ahead, Supervisor Sabatier.
Let's see, later on today, if we finish in time at 3:30, I will be at the Cal OES CSAC state phone call with other supervisors, public health officers, and other elected officials and local leaders. I will be bringing up some of our issues to see what's going to happen with our test site, and we'll see what kind of response that I receive. Still haven't gotten to my calendar here. Tomorrow I am starting off my day early, listening in to the Lake Economic Development Corporation Board of Directors meeting, moving on at 9:30 to a LAFCO meeting. Then there will be an abandoned vehicle abatement meeting over at 1 o'clock. And if that finishes in time, and actually I think that was canceled, but there was a marketing committee in Clear Lake. I'll have to check in and see. I am also planning to go to the Canocti USD board meeting, as I'm very interested in knowing how they are going to move forward. And I do want to make a statement here. Yes, as a board of supervisor, we do not have jurisdiction over schools, but we have to recognize that at this moment in time, we definitely have a connection to what's happening, as Dr. Pace is heavily involved in helping guide our school districts on how to open up, if they open up, and how they will open up. And so while we don't have a say, we definitely have our foot in that pie completely. And so then I will be going to the Clear Lake City Council meeting on Thursday. I have a couple other things going on that day. On Friday, I will be meeting with a couple constituents who might be running for city council for the city of Clear Lake. And then coming back, on Monday, I don't believe I have anything yet other than I will be again volunteering at the testing site and meeting with Carol Hutchinson, Ms. Hutchinson, to discuss our July 21st agenda items, as well as other things. That's it for me right now.
Thank you, Bruno. Supervisor Scott?
Tomorrow I have meetings with constituents in the morning, and then in the afternoon, a planning meeting with the COC. On Thursday in the morning, 10 a.m., I have a COC meeting, a law library meeting at noon, disaster council meeting at 3. On Friday, I'll be spending some time at the COVID Center, helping some of our guests get into programs and get paperwork done. And we're also looking for the RFP to close. Hopefully something comes in on the 17th so we can make some decisions around our COVID Center. On Monday, the 20th, I have a meeting at 10 a.m. concerning the shelter. At 3, I have a Camp Kanaktai meeting. And then also have a Hope Rising meeting that afternoon, and then back here on Tuesday.
Thank you, Supervisor Scott. Supervisor Crandall?
Yes, so tomorrow morning I will be attending the NSBA, North Shore Business Association meeting via Zoom. Thursday, we have a special WANB meeting, Workforce Alliance of the North Bay is what it is. And I think, Moke, you'll be at that with me as well. In the evening, I'll have the Lucerne Town Hall meeting via Zoom as well. I have a meeting out in Bachelor Valley with constituent, and then on Monday, the COVID recovery group meeting, and then back here next Tuesday.
Okay, see Supervisor Brown is gone, so I'll jump into my calendar here. Board meeting today, workshop this afternoon, and then agenda review after that. Tomorrow morning, just as Supervisor Spatier said, we have the LAFCO meeting and the AVA meeting, the abandoned vehicle abatement. Knowing obviously those are going to be by phone call or Zoom. Thursday, have a department head meeting. And also, as EJ said, a short WANB, a Workforce Alliance in North Bay meeting, and then also the Disaster Council later in the afternoon on Thursday. On Friday, start out with the EOC call with the health department in the morning, and then moving into Monday, have the COVID recovery, the EOC call in the morning, COVID recovery group, and then the Risk Reduction Authority meeting on the 20th, and then back here for the 21st. So I think that covers everything, but meetings are popping up constantly, and we'll just continue on with texts and emails with constituents as we move through next week. So I see that Supervisor Brown has left at this point, so we'll go ahead. We'll go ahead and get his calendar update later on. But we're going to go ahead and break for lunch. I think we're right at 12:30 here, 12:26. So we're going to go ahead and break for lunch now, and we'll be back at 1 o'clock. Thank you very much, community, constituents. We'll see you at 1. Okay, we're going to go ahead and reconvene our July 14th Lake County Board of Supervisors meeting this afternoon. What we're going to start with, we're going to go right into our economic development workshop. As soon as that's over, we'll finish up the agenda items that we still have left. I think we have items 7.2, 7.5, and 7.6 to finish up afterwards. So I'm going to go ahead and start with our 1 p.m., our economic development workshop with county department heads. We're going to have 4 of these workshops. I know we've been moving around. I appreciate everybody's, all the department heads, patience with us as we move through these agenda items and get this completed. Once it's done, like we talked about, we'll put a task force together and really look to dive into things more directly. So we're going to go ahead and turn it over for the economic development workshop.
Thank you, Mr. Chair. So as you stated, this is the third in a series of 4 economic development workshops. Today we have our law enforcement department heads here. And as you know, this stemmed from a special session your board had back in January with all department heads, where we talked about the need to really jumpstart economic development in Lake County. Of course, no one was thinking about a pandemic at that time, but certainly the pandemic situation even makes that need greater, the need to get rolling with economic development. So during that workshop, we identified 9 priorities that we intended to focus on. And I'm not going to read them all to you. I did the first of these workshops, but today I just have them before you. So that is the first 5. And then here are the next 4. And these are not in any kind of priority order. So as you know, we've been grouping departments together in as close to like groupings as we possibly could. For the law enforcement department heads, it's obvious to everyone that safer communities certainly lead to promoting better economic development in our communities. So I want to welcome our Sheriff Brian Martin, our Animal Control Director Jonathan Armas, our Chief Probation Officer Rob Howe, and our District Attorney Susan Coronis. And we're asking that they kick off the workshop by reviewing with your board the highlights they included on their worksheets in preparation for this. And with that in mind, I wonder if we might turn it over to the sheriff.
Thank you. So in the worksheet, it asked for some project descriptions that we've been working on at the Sheriff's Office. Actually, before I get into that, I just want to, again, restate what Carol said about having safe communities for people who want to come to visit and live and bring their businesses to. If people don't feel that it's a safe community, they're not going to bring their business here. They're not going to move here. So for me, I'm probably a little bit biased, but I view public safety as one of the top priorities in this economic development. And with that, we're constantly looking for ways to most efficiently spend our dollars that are increasingly hard to come by. Some projects that we have on tap at the Sheriff's Office, probably one of the largest ones that I don't think is a short-term project. It's probably going to be several years in the process, but the National Guard Armory that had been abandoned by the National Guard by close to 2 years ago now. What I would like to see is in the long term, the county sheriff's office administrative facilities going over there and consolidating with the rest of our operations to include the dispatch center, the emergency operations center, and the jail. We have a couple repeater sites that are in project. A lot of this funding is coming from state Homeland Security grant funding. Radio operability throughout the county has traditionally been an issue here with the mountainous terrain. We've had there's been lots of areas that have had difficulty with radio reception, and we're working to fix those solutions. And in our jail facility, we've increased video visitation, and that's especially taken off since the coronavirus. People want to limit their interactions, so we've really looked at some ways to increase the availability of video visitation, but still retain the ability for in-person visits as things start to ease up, especially with the coronavirus. Jail capacity, the facility was licensed for 286 people when it was built. What we're seeing at the jail now is obviously with realignment, we have a very different classification of inmates that are housed out there, and overpopulation generally occurs well before we hit that 286. A lot of the spaces that were counted in those numbers during the initial certification were dorm style settings where you might have people that were there to serve a weekend for a DUI or driving on a suspended license or not paying child support or bouncing checks. And those dorm rooms largely, we still have to have them, they largely remain very underoccupied. So consequently, when we get our population increases, we're putting them into places that weren't anticipated to host or hold or house the high classification of inmates that we're now seeing with the various criminal justice changes. With that, the electronic monitoring plan that we have out there is woefully past the time that it needs to be reviewed by the Board of Supervisors, and the amount that we charge people to participate that is woefully less than it actually costs to facilitate that. So when we're talking about things to bring to the Board of Supervisors, expect to see something of significant adjustment for that program. And what the alternative work program, electronic monitoring program, is if somebody's suitable, if they have a suitable conviction and they're sentenced to serve time, they can serve time on home detention rather than take up room in our facility. And of course, that's not available for everybody, but there are certain classifications of inmates that will be available for and reduce the impact on our population. Tower and control project at the jail. The jail is quickly coming up. I think it's about almost 25 years old now, or actually the phase 2 is actually 25 years old now. And the system that controls the opening and closing of the doors is reached its end of life. It's a proprietary system. So it's going to have to undergo a major overhaul. And that project, I think, has been to the board a couple times. It's still in the process. It got delayed because of coronavirus. And much the same with the jail roof project. Under the category of other than more staff, what supports do you need to overcome any barriers? I really can't answer that question other than more staff. I've said several times in front of this board and in public, we provide services by having people deliver those services. And without the people, we can't deliver those services. My budget, my various budget units, we gave up a total of, I think, 24 and now 25 positions since the last fiscal year, our allocated positions. And that includes one of the school resource officer positions. We didn't receive the funding from one of the school districts. The school districts are also grappling with financial challenges. I don't think it was, the decision wasn't anything political. It's just a matter of there's only so many dollars that can go around, and they had to cut the funding for that school resource officer. So we're at a total of 25 less allocated positions across all departments in the sheriff's office than we were in the previous fiscal year. I need those bodies. I need those positions. An example of where that really impacts us is the staffing at the jail. We currently have less people assigned to the jail than we did 25 years ago, or less allocated positions. When the jail project was approved back in 1995, a 30-year cost estimate was put into place and or projected staffing needs and cost estimate. And what that cost estimate projection said that during this fiscal year coming up, the 2021, it would need 55 correctional officers, which are deputy sheriff corrections now, and my current allocation is 41. So we're in the business of providing services. We're not really in the business of generating revenue. Our role is to make sure that communities are safe. Our role is in the rehabilitation process to provide programming for people that are incarcerated. And in order to do that, I need more positions. So I think that about covers everything that I have. I'm happy to take any questions from the board.
Thank you, Sheriff.
Are we doing questions at the end?
The way we've kind of done this is if we could allow this group to go through and do their presentations, then we can come back and ask questions. Okay, so who would like to present next?
I'll go.
Good afternoon, Rob.
If I'm not skipping in front of somebody that also wanted to go. As far as some projects and priorities that we have here in probation, I'll just list a few that we're interested in. The first is identifying and pursuing grants for youth and family preservation, especially targeting youth that have interactions with probation. Many of you know about our family RAP programs. Unfortunately, those programs have taken a hit in funding recently. We like those programs, want to keep continuing, so we're going to be looking for alternative ways to fund those. We're already pretty active in looking for outside sources of revenue in probation. We've always been well over 50% non-general fund revenue to run our department, even though we are a general fund department. But we plan to up that a little bit. We're looking at freeing up time specifically for our staff services analyst positions to be seeking grants and looking into alternative sources of funding. Something else we're looking at, and throughout a few of my little bullet points here, it's kind of repetitive, but we're looking at putting probation classes for probationers in an online format. This is something that and I'll kind of give a little disclaimer here. A lot of the stuff that I'm going to talk about has to do with our services to our clients, our probationers, and that in turn is what we provide to the community, enhance public safety. So for our probationers, the online format thing is something we've looked at in the past and we've kind of experimented with, but the COVID thing here has really pushed that. Most of you probably know that we're doing our DRC courses online remotely, and we're having some success with that. So we're certainly going to look at increasing our ability to do that. One thing we need assistance with, I guess one of the hurdles, as this was worded, is assistance in promoting and recruiting foster parents. We get approximately 7 at any given time, 6 or 7 foster youth ordered into foster care, and we don't have a whole lot of success here locally recruiting those kind of foster parents. The group we deal with is challenging, as you could imagine. Not a lot of people are willing to take that responsibility on for older teenage kids in foster care. If you've attended anything like the fair back when we had things like the fair, you probably see probation's booth out there. We do a lot of recruiting. We're pretty active on Facebook. But in the coming year, we're going to look to increase that and perhaps improve our partnership with human resources, with the board, with admin, to make sure that word gets out there. We would like those placements to be in county. They're typically not right now. So that recruitment's something we could probably use some help with. Again, internet access for probationers. Internet access countywide has always been a challenge. You people certainly know that. Again, we've had some success during this COVID thing. We've learned that we knew that one of our biggest hurdles for providing services was the fact that our county is kind of spread out, and transportation travel could be a big hurdle. So maybe being able to provide our clients with perhaps a computer or internet access, that's something we want to look at. That's like everything costs money, but my initial thought is that we may save more than that in travel, transportation, overtime for officers, that kind of thing. So that's something we want to look at. Technology for our probation officers. I think we're pretty progressive with that already. Our caseload management, or Caseload Pro is our case management system. Our electronic monitoring, all of those are web-based. We've provided all of our supervisors and many of our officers with access to those in the field. But we're looking to build on that, to give all of our people real-time information on what they're dealing with out there. Let's see, and some more things that could help out. I think you guys have probably heard this from other department heads: electronic payment methods, credit card, accepting credit cards, that kind of thing. Access to account online. Another thing I listed here was a facility in Clear Lake area to host our probation classes. That's something we were thinking about, and I probably put in here prior to the COVID incident, because now we're kind of rethinking that rather than looking at offices that are obviously expensive. We may be looking at more online and web-based opportunities for our people. Let's see. Other than that, as I said, I think in our department, we've been kind of forward-looking. We've expanded our use of our caseload management system. It's streamlined our operations from pre-sentence reports all the way through supervision, kind of reduced a lot of the redundancy in our reporting. We've had quite a project going here to move to almost paperless. We've looked into scanning and electronic storage. We've actually saved about 300 square feet of office space that now houses some probation officers that used to just house paper. So we're making progress in that area. And I think that's about all I have for you. I'll answer questions whenever you get to it.
Okay, Rob, thank you very much. Okay, we'll move to our next presenter in this group right here. I know we have four. We have Jonathan Armis and Susan. I don't know who wants to go next.
I'll go.
Okay, Jonathan.
Good afternoon, Supervisor. So I'm Jonathan Armis. I'm the Director of Animal Control. So some projects that I think are important beyond our law enforcement aspect are things like our community cat and low cost spay and neuter services. No one wants to have, a whole bunch of cats in their backyard or anything else like that are feral and stray. And we do have that problem throughout our county. So I think a continued support and potential expansion may be necessary. And the reasoning is that we either need to remove and potentially euthanize 50% of that population or fix 90% to control that. We're in the process, but I think it's important to update and streamline our shelter management system. Our officers don't have access in the field. It can be quite cumbersome at times and is showing its how dated it is. We have procured it, but COVID-19 has kind of slowed us from fully implementing the system. Another issue that we have at Animal Control is not just staffing levels, but actually staff retention. And that's one that I believe that we should look into as far as trying to give opportunities for training or any other issue or any other programs that could provide retention of staff. We have a constant rotation of officers for as long as a lot of people can remember. And then the other thing that we have that can affect public is we have permit systems that might have to go through community development and then come back to animal control, among other things, and streamlining a process so that everyone's on the same page. So we're not telling public to go to another department when maybe it's not required, or even the wrong information, so that public's not getting transferred to multiple departments or having to physically drive to those areas to complete a permit or a kennel inspection or anything else along those lines. So support, like I said, for our community cat program, I would like to expand it eventually. But at this point, it's not a revenue driver as much as we try. Our program, we don't really need support to do. We just need to continue working on figuring out some of the back end issues and implementing them. I do think that departments could use to meet with other departments that have a close interaction and possibly getting kinks worked out. I try and do that as I can, but right now it's email based and sometimes confusion can still set in. I do like the CSAC training that was provided to staff. I think that's important, and maybe an expansion of some type of training, such as those are great. And then I do believe, like for our department, that works very well, but is always potential issues, but is constant communication with the public, making sure that we're always updating on anything. For example, someone calls in with a complaint, we try and make sure that we call, update them, and let them know where we're at. Sometimes that can be difficult. And as long as all of our departments are working towards that, we can definitely keep people happier with using county resources. And granting ease of services, such as like our new shelter program that we're doing. So we could do online adoptions or more things online, I believe is very, can't think of the word, sorry. At any rate, it's very beneficial to the public, and they do appreciate that. So I think that's all I really have as a total. Beyond law enforcement, I tried to look at other programs and services that we do provide.
Thank you, Jonathan.
Okay, I guess it's me. Is this mic on? I don't know.
Yeah, I don't hear, we don't hear you.
She should be good now.
Can you hear me now?
Yep.
Okay.
Excellent. Thank you.
Okay, well, as outlined in my written response, one step that I think it would be very helpful is the DA website, to revamp it and provide a lot of information. I've been looking at other websites for DAs, and they have a huge section about how to do various things that people are used to going on the internet and doing the step-by-step things and how to get a protective order. What do you do if you're a victim of a crime? I know the sheriff and other law enforcement probably has this on their website as well. I'd like to, step up the DA's website to provide that. But we don't have we have a website, but to keep it up and to put on all of this new information, I think is going to take a lot of time, and possibly contract with an outside contractor to do that and keep it up, because we don't have anybody in our office we may have somebody who has the technology, but to, have the time to do that specifically. Also, I mentioned establishing a mental health court. This has to be in cooperation with the courts. I see so many cases, and over and over again, people go through the system with mental health problems, and they get prosecuted. They're told to go to mental health. They don't. Nobody's monitoring them because a lot of times they're on summary probation. There is a mental health diversion as well, where some people can apply for it and it would be granted, But again, who is monitoring that closely, with the closeness that it needs? It needs hand-on assistance and monitoring like we do in vets court, where they have an obligation to come to court or contact the court, once a month even, and somebody is there for them to call and say, hey, I need help. I think that would really help in the community for economic development, to reduce, individuals who are just going around the streets yelling or, harassing people or creating problems, and give them a place to, go to for help, that they can contact somebody immediately if they're in a crisis. And that is, again, even with vets court, with COVID-19, we're still able to do that effectively through Zoom meetings instead of having them come to court. So I think that would be, go a long way to assist economic development. There's a couple other things that was brought to my attention, or I came up with, that's not on my list, and that would be to add programs or resources to reduce theft loss to merchants. Since Prop 47 passed years ago, merchants, Safeway, Foods, et cetera, stores like that, the amount of petty theft to shoplifting has increased dramatically, but there's no recourse for it, because if it's under $950, they can go in every day and steal something, and it's a misdemeanor. It's never going to be a felony, no matter how many times, and a lot of these stores just throw up their hands and just kick them out, but what's law enforcement going to be able to do? So come up with a program to assist merchants in that regard, in regards to these constant thefts. Maybe even some kind of program that can compensate them for their losses. A lot of times you have also vandalism to their stores in many different ways. And I think, some kind of program to compensate them for that. Looking at reality, these individuals that go in and continuously steal from the store, even if they are caught and they are, prosecuted, they're ordered to pay restitution. They don't have the money, so the store doesn't get the money back. In addition, we could look into, I think it would be helpful to look into whether or not we're getting all of the TOT money from the various merchants, hotels and motels. I think if we were to investigate and prosecute even just one or two merchants for not turning over that tax, that would be a sign for others that, hey, you need to turn over that tax. I think that in the past we have had some, and I'm sure that this does go on, where either the merchant, the business, does not collect the tax, or if they collect it, they don't turn it over. So, obviously that's very important that we get that tax. That's a lot of money coming into the county that we definitely can use. And I think we need to look into that and see if there's any problems with that not being turned over. So with that, I will answer any questions.
Excellent. Thank all four, everybody, Brian, Rob, Jonathan, and Susan, for presenting. We'll go ahead and turn it over to the board and go ahead and open up for questions and concerns for all four who presented at this point. Supervisor Sabatier.
Thank you very much. Thank you to the department heads that are presenting to us today. I think that we're asking you a difficult task to help us with economic development, and I know it will be easier when we come back to you once there is a plan to look at to see how you can help us make this plan come to fruition, rather than just looking at your departments on its own or looking at the entire county on its own. I think it's a difficult task to look at because there's so much to bite. It's hard to know exactly where to start. I have a couple questions hitting every different department. One of them is for Sheriff Martin. Have we ever done focused attention to a certain area to try to decrease crime? And if we have, did we see positive results from doing that? And not to say that we're no longer focusing on the rest of the county. I don't think this is to ignore phone calls, but it's to say we're going to do some extra patrolling when we have the ability to patrol in this area. Have we ever done that before in the past, and what was the result if we did?
Absolutely. What you're talking about is the theory of problem-oriented policing, where you assign additional staffing and resources to areas that have higher crimes and community quality of life issues. When I started here, there used to be what we called a community service deputy program. We have basically four beats throughout the county. There's several sub beats, but it can essentially be broken down into four, excluding the lake, excluding the public lands and national forests. And I actually served as a community service deputy for the Clear Lake Oaks North Shore area. And there was other community service deputies that were assigned to Nice, Lucerne, Upper Lake, one to Kelseyville, and then one to Lower Lake and South County. That program basically assigned a single deputy to only work in that beat during the week. And they were tasked with going to different community organizations, your Rotary groups, your business owner associations, and really kind of making a connection. That's one of those programs that's gone away with the elimination of positions. We had a large exodus of people. As I mentioned earlier, I cut 26 positions from my budget, from allocations, and that's going to be one of those types of programs that we are no longer able to support without additional staffing. As far as the success of it, you actually have somebody on the line with Chief Howell. He served as I think he was either a sergeant or lieutenant when I first started here, and served in a community recovery task force that used community development money, or community PBDG money to be funded, and that funding source went away. And I don't want to put Chief Howell on the spot, but he could probably talk about some of the experiences, some of the successes that they experienced in that program.
Yeah, you talk about the Community Recovery Task Force was a Clear Lake Oaks task force. It combined two Sheriff's Department employees. I was a sergeant at the time, and the coordinator, an animal care and control officer, a probation officer, and a code enforcement officer. I don't have the stats in front of me. I wasn't prepared. Also, I'm old, and that was like decades ago, but I think it was very successful. We were able to do some things and focus on an area, hit them from all angles. We'd do a search warrant. Code enforcement would come in and have the house red tagged. We were finding that the same house housed a whole bunch of different criminals. You take one to jail, and that house is still a drug house, right? So being able to hit it from all different angles was, I think, very effective, ideally effective. In fact, back in those days, I thought if we could do one of those for each beat, God, what a tremendous effect you'd have. But like everything, it comes down to funding and primarily staffing. I don't know of any of those departments right now, the Sheriff's Department, Animal Care Control, Probation, or Code Enforcement, who could just dedicate an officer or a person to just doing that. We were full-time. That was our job. Very effective, but again, it takes a lot of resources, and without the resources, it obviously didn't work.
That was a time back when crime was illegal. So
that's true too.
That's not the case anymore, so I don't know. There's some benefits to it, but I don't know that you'd be taking people to jail these days.
There's always going to be a benefit of just high profile. Obviously, it wasn't long before a small community like that realized we were there in force every day. We saw the code enforcement part of it was surprising to me. Obviously, that's not my profession, but how many people we had cleaning up their freaking property just because they knew we were going to be there every day. Animal care and control, we had pit bulls and other dogs, and nothing against pit bulls, but that just seemed to be the dog of choice. running free. And again, it was just in a way to affect an area in a lot of different positive ways.
Yeah.
And I appreciate that, and I recognize that we're talking about programs of old, and that times have changed, but I think that looking at ways to maneuver through the new rules and regulations we have to abide to, and seeing if certain, this can rebuild itself, granted if we have the funding available. And I think that if we just have it on paper as we finalize these economic development conversations and say this is our goal, is to get this back, because we do see that there will be positive outcomes out of it, then at least it's a goal that we can set in front of us, so that as we build our budgets in the future to come, we can slowly make sure that we have money set aside for these types of things, especially if we anticipate that there will be some positive outcomes. And I'm assuming that Sheriff Martin, that you will agree with me that there are certain pockets of areas in our communities that have higher levels of crime than other areas, which means that we can still look at a focused enforcement and still make a difference, or potentially make a difference.
Of course, yeah, but again, I need people.
Right.
With that in mind, we had a program that we had been running up until late last year, early this year, where just once a week we had paired up a deputy sheriff with a code enforcement officer to go out and tackle those types of issues, where kind of there was a lot of times you'd have a cross-pollination of law enforcement issues and code enforcement issues, much like Chief Al was describing, your quality of life issues, people with yard cars, loose dogs, garbage all over the place. And sometimes those same houses might be where they're dealing drugs or having domestic violence, or people getting drunk and causing neighborhood disputes and disturbances. So we would team up once a week, identify what priorities there were, and go out and handle it. Unfortunately, both of the, I got 2 deputies assigned to that at different times. Both of them went out due to pretty significant injuries. One is still gone, and we're still grappling with, with the budget that's coming up. I don't see a lot of hope that I'm going to get funding for additional positions to perform these duties. So again, what this all comes down to is need bodies to deliver this. You can have all the programs you want, but if you don't have bodies to implement it, the service isn't going to get delivered.
Right, and again, it's all about figuring out what are our tactics and strategies that we choose to move forward with, and then figuring out how to make those happen, whether that's funding for new positions or rearranging of things, then that'll be figured out as we move forward. Because to me, we're talking economic development. Economic development is all about stability and predictability, and at that point, once we show we have a stable environment for businesses to flourish, and a predictable environment where they know what's going to happen tomorrow. COVID-19 is not a predictable environment where today you're open, tomorrow you're closed. We need to get to a different place where the economy can start to flourish, or else it's going to be very difficult to be able to grow with this certain time that we're dealing with. I have a question for Director Howe, and that is, what is our current recidivism rate, and is it what's its trend?
I couldn't tell you. This is an interesting thing. Funny, I was thinking about this not too long ago. Recidivism rates were a really popular thing to talk about when AB 109 came about in 2011. Or excuse me, yeah, that was right here. We don't hear as much about them. There's always a controversy as how you define it. Some people want to think recidivism is if you're rearrested again at any time in your life, if you're rearrested and convicted at any time in your life, or if you're arrested and convicted during the time of maybe your probation. Almost every agency that I was aware of, from the CSSA, the Sheriff's Department, from Cal Chiefs to CPOC, Chief Probation Officer, kind of had a different definition of what it was. So to tell you what it is I really can't. I always hear, the 70% thing thrown about, and I think that might be accurate. And to determine if it's up or down is just going to be such a challenge. Again, something else I was thinking about is how are we going to find out what COVID did to our numbers? We're not doing as much in-person stuff. And of course, we're doing our DRC remotely. And I thought, is that going to hurt us or help us? And it's probably not something we'll know for months or years, if these probationers commit more crimes. But even if they do you blame it on COVID, or do you blame it on the fact that there's all these bills out there that reduce crimes, or bills that do away with fines and fees, or bills that do away or want to limit probation to 2 years? There's a lot of aspects of it that would go into that. So, not trying to skirt your question, but I really don't know. We try to look locally, and we have our successes with the DRC. We kind of keep track of those stats ourselves. But on a bigger scale, I just really can't answer for you.
Okay, and I think that those types of measurements are going to be important in, because I don't want to look at economic development in a vacuum. I want to be able to say we are using these measurements to see that the outcomes of whatever strategy we choose to go with has moved the dial forward. And I think that maybe recidivism rates might help us out as well, because a blossoming economy typically will decrease the number of arrests that we're seeing, because petty crime is not an actual need. This is what we saw in the late 90s. A lot of people want to blame the 3 strikes law, but it was being reduced all across the United States, not just in California where we passed the 3 strike law. And it's because we had a blossoming economy and also less 15 to 25-year-old boys hanging around doing crime. And so I think we need to look at the economy as a factor in reducing the need for service from our law enforcement, from our probation, and that it's important to look at those numbers. I'm going to move on to Director Armis. You talked about technology and the constant connection. You, in my mind, are an arm of law enforcement, and I see too often that we separate animal control and our law enforcement, but it's important that you're in our communities to deal with the threats that animals can pose sometimes to those communities, and ensuring that you have constant connection and contact and communication is important. It's important for being efficient out there, and it's important with keeping the community safe. So I think that's one of the things that I'd like to look at, because if you can do your job more efficiently out there, then we're gaining from whatever changes that we just made. Because right now you're limited in your capacity of what you can do. And I know that our district attorney, Susan Cronus, brought up the mental health court. Her and I have had these conversations and met with Sheriff Martin and Director Howe as well. I know that we kind of discussed it as a whole, more like a homeless court. And I think that it's absolutely still a direction we need to go, because we are spending so much on what I feel is something we're not gaining momentum in solving, and we need to figure out a better way. I've witnessed veteran court, granted not on multiple occasions, but I've witnessed it, and I think that it is absolutely a positive model for us to look at. Other places have done mental health court or homeless court, and I think that that is something we need to keep pursuing. If we can get people out of this system, and out of the cycle, then we can benefit from them becoming participants in our communities. I think those are good ways to help our economy, and every little piece is a chip off the block. There is not one answer that solves all of our economic issues. Sorry for taking up so much time, but that's it for my notes. Thank you very much.
Can I just, I'm sorry.
Go ahead, Supervisor, or go ahead, Sheriff Martin.
Yeah, before we move on, I think, did I hear Supervisor Sabatier say something about reducing the need for law enforcement and probation?
I did, yes.
So I want to clarify that, because that almost sounds like code for defund the police. And, if that's the way we're going to go, then I guess that's the way we're going to go. But I don't think now is the time, given what we're seeing in our communities with the crime rates increasing, to talk about reducing the need for additional public safety.
And I think that you didn't hear my entire comment. It was, if we increase the economy and if we can get things going better, then there'll be less crime out there, which will reduce the need for your services, not reduce the need for your staff. If we can get you patrolling more versus being reactive to the phone calls you receive, which is what I experience all the time in Clear Lake, we need to be proactive in our policing, not reactive. And unfortunately, more often than not, because of the number of phone calls we receive, we end up reactive. And if we can change that so that we have now more proactive policing ability, that reduction in crime is going to make us eligible to do that. And it's not there was no code in there for defund the police at all. It was just a change in, we have to do what we have to do right now. We can't ignore those 911 calls that we receive. We have to go out and deal with the threats that are out there. And if we can make our economy be better, those threats will change and we will have a much more proactive policing ability.
I know that as well as anybody about the need to go out there. What I'm telling you during this meeting is that I don't have the ability to do that with the staffing levels that I have and with the staffing levels that I envision or I'm predicting based on the numbers that I'm getting for this current budget. So what I would like to see is hopefully, rather than focusing on what it's going to look like 10, 15 years down the road, however long we're going to get there, let's tackle the issues that are right in front of us. I'm asking you for staffing. I think what I'm hearing from the probation department is they're probably asking you for more staffing. I know animal control has issues regarding getting called out after hours and on weekends because they don't have staffing. As a department head and as the sheriff, I'm here to tell you that we need some bodies. We need some people to perform these functions. We can't just do it. You can't have a plan that's going to work without the bodies that go towards it.
And
Thank you, Sheriff Mark.
So, I want to just expand on that just
Go
a
ahead,
little bit.
Supervisor Brown.
Because I appreciate what Bruno's saying, but I also, it's a different perspective when, and I don't mean any disrespect to this at all, that, it's a different perspective when you're coming from a city where you actually have policing as opposed to sheriff's law enforcement and county law enforcement over a broader area with virtually the same amount of people or, far less people per capita. And the county is responsible for funding the 90% of the law enforcement in the county that the cities don't have to account for. The DA's office, probation office, code enforcement for Lakeport, animal control in Lakeport, but Clear Lake has their own. So it's not the same. And yeah, it'd be nice if you could go out and do proactive more. They're already doing some proactive, but the reality is it is a reactive business. This is the nature of the business, is you're reacting to things. The cities aren't funding the jail, which is huge. So it's not exactly the same as it would be for police officers to be able to just be seen in their local communities and that type of thing. It's a different animal. They try to make it the same, but it just can't be. It's not possible. To go back to what the sheriff said about giving bodies, now that we have the positions, we just need to fund them. And we need to get money in order to recruit and hire and retain. That's the issue. It's not giving more positions until we get those filled. There's no point in dealing with more positions that could end up just being vacant positions. I'm sure Susan has the same issue. I'm not sure exactly what your status is right now as far as positions go, but everybody's kind of the same. Rob's the same. So I just wanted to throw that in there that, community policing is, it's a popular term. I get it, but you're talking about a completely different animal when you're talking about county level than it is with city policing. So.
Thank you, Supervisor Brown.
Can I comment on that issue?
Yes, go ahead, Susan, and then after you, I'll go to Supervisor Scott. Go ahead, Susan.
Okay, I just want to address a couple of points that just came up. First of all, Rob, yes, you're right. We have the same issue. We have, open deputy DA positions that we have recruited for, and we're not able to fill them because of the pay. We've had numerous individuals say, well, get more pay in another county, so it's discouraging. And the crisis that I see is we have a lot of deputy DAs that have been there for a long time, and they're going to be retiring in 2 to 3 to 5 years. And if we can't recruit people now that are going to be coming into on the entry level as misdemeanor attorneys, we're not going to have attorneys to do the big cases, the felonies, the murders, the rapes, the sex offenses, because they won't have that experience. So that's a concern that I have. In regards to recidivism, now this is a here and now issue, but it's going to affect us for years to come. Obviously, it's beyond our control with the COVID. You know, in terms of the court system right now, there are so many misdemeanors that are being put off to next year for trial or to continue prosecution. So, basically, by the time we get to that time where we're going forward with somebody's case on misdemeanors, they probably have already committed new ones. So it's that impact, because of the backlog on that, is going to impact us into 2021 and probably 2022. So that is discouraging. And on the other end of it, we're getting notice just this past or last week that we have the statewide, they're releasing a substantial number of inmates. And Lake County has, I didn't count the number, but at least 20 or 30 individuals who are going to be released back to Lake County after not serving a fraction of their sentence. And these are individuals that I think committed potentially very violent crimes, like evading the police, going on a high-speed chase, where there could have been deaths on that, but the state does not consider that a type of crime that they're looking at it like it's a non-violent crime, so we can release them early.
It's not nearly as serious as not wearing a mask, for sure.
I would say it's not nearly as serious, yes. But I would, so those people are coming back to Lake County in the next 30 days. And it's very frustrating for me because I looked at the list and I'm familiar with each and every one of them. I've prosecuted a lot of them, most of them over the years, and they're coming back. I guess they're going to be on PRCS, so, but again, these are people that are coming back to our community early that, are going to be on PRCS and have to be monitored, and then that goes with probation. They're having shortages and having problems monitoring these people. So some of them also, I don't know how many, may have been exposed to COVID or tested positive. Yeah. So anyway, I can work with Rob Howe on that issue. But this is going to impact us, for several years to come.
Okay, Susan, thank you for that report. Tina.
Well, I don't have any questions. I just really appreciate having this discussion. I really do struggle with how our police force can bring economic development into our community. I definitely see it as building our economy so we can provide the police and those services that our community deserves. So when we do bring this discussion back, I think we definitely have to be looking at ways that we can put more people on the ground. I agree. You can't provide these services unless you have people to provide these services. So this is definitely not a new challenge. This is something that we've been looking at to try to figure out. One theme that I did hear today that we've heard in our last session with economic development is technology. So this is just another place that we need to be looking at different ways we can use technology to better serve our public in an easier fashion. I'm excited that Rob Howe is also looking at maybe not putting up an office building, but looking at online services, seeing if that would better help our parolees be able to get the check-in and the classes that they need. I also would like to look into the mental health court. I'm hoping maybe Hope Center could help with that piece of that, providing those services. that person to look out to see if we can't connect those services. But again, it's going to be coming back to the Board of Supervisors, figuring out how we can build our economy so we can provide the services and the funding that is needed to have these people in our community keeping us safe.
Thank you, Supervisor Scott.
Excuse me, can I chime in on what DA Cronus said? Just to give a little info about the CDC hourly releases. So far, our department, we have 9, and we're getting 14 more this week. These are, and that's just the PRCSers. If you don't understand the system, there are plenty more on parole that are being released early. That just doesn't happen to come to a county department. Just some numbers.
All right, Rob, thank you very much. Supervisor Brown or Supervisor Crandall, I don't know if you had any questions or comments for the presenters or department heads?
No.
I see none. Well, I really appreciate, your guys' patience with us. I know we moved you on, and it is a difficult question, but ultimately, we've heard you loud and clear, obviously, on the staffing issues that we have moving forward. I am encouraged, too, about the technology operations or endeavors that are being looked at during COVID-19. And ultimately, it's been touched on here with the board. We've got to make, gather all the information as we're thinking economic development, not only on what we're doing for our surrounding communities, but what we're doing internally to help get our heads of departments get the proper staffing they need and other things. And I think that's a vital role for the board as we move forward through these conversations. With that, seeing no one else, Supervisor Sabatier, go ahead.
I wasn't raising my hand, but I will say.
Oh, I thought you were.
I will say one last comment, and I think that every department finds it important. We've heard it loud and clear in the past about staffing. But to me, the gist of our conversation today is listening to our departments so that we can formulate a plan, and within that plan, if in order to enact on that plan, it requires more staffing, then we will be looking at how to make that possible. And I think that it's important that we look at a plan and not prohibit ourselves from creating such a plan based on our current status. We have to fight for every dollar that we need to make something happen and change. And economic development will have vast domino effects on everything if we can have a plan and slowly roll that plan out. So that's what I'm really hopeful to see, and I'm willing to work hard to make sure that we get to that.
Okay, any more comments from the board?
My microphone was
okay,
off.
go ahead, Supervisor Crandall.
You didn't hear me, so I just want to thank all of you for giving your presentations, and I really appreciate hearing about the mental health court. I know that in working previous to my experience on the Board of Supervisors, I work with tribes, and there's different aspects where they have equal court, which is like keeping your children, things like that. It's just a mechanism to keep people in accountability, and that's all. And it helps and reinforces what's going on with the other authorities that be. And I just want to say that, Sheriff Martin, I empathize with you on the bodies. You need the bodies, and in essence, you've already kind of been defunded, so you know how to work already towards getting what you just know what you need, and we need to formulate a plan to help you. So that's what I intend to do. So
Thank you. Okay, if there are no more comments or questions from the board, we'll go ahead and open it up to the public. I don't see any hands up at this point, Jake, so can you just open the room?
Yeah, I will open the room here. The floor is unmuted. If you would like to make a comment, please state your first and last name. It doesn't look like we actually have any unmuted mics here either. So.
Okay. All right, Jake. Go ahead and close it up and bring it back to the boardroom. Do we have anyone in the boardroom that would like to make a comment?
I'm not seeing anybody that wishes to make a comment at this moment in time.
Okay. Thank you very much. All right, so we'll go ahead and bring it back to the board. I see Carol, you've unmuted. Go ahead, Carol.
Well, I did. I think I sense that we're wrapping it up, and I just wanted to remind everybody that the last in the series of these workshops is scheduled for the 28th of July at 1 p.m. We decided not to try to put that on the calendar for next week because your board has the Maha project on your calendar again next week, and our concern was that it would, if it ran long, it might cause a postponement again. We didn't want to have that happen. And so on the 28th, it will be your Health and Human Services Department heads, and that is Crystal Marketan of DSS, Denise Pomeroy of Health, Todd Metcalf of Behavioral Health, and Gail Woodworth of Child Support.
Okay, Carol, thank you very much for that update. Sheriff Martin, Rob Howe, Susan Cronus, and Jonathan, really appreciate the time that you put into this. I know how, thinly stretched each and every one of you are, and appreciate for the time today. And we'll continue this conversation moving in the direction of positivity for Lake County. So thank you very much. You guys are a big part of that. Thank you.
Thank you.
Thank you.
Thank you.
Okay, moving to our next agenda item. We'll move right into item 7.5, a consideration of update on the county's COVID interim policy for working remotely. Carol.
Thank you, Mr. Chair. Hopefully this will be a simple discussion. As you know, for the last 4+ months, you've allowed staff to work remotely under an interim policy for that. And the last time you reviewed it was in mid-June, and at that time, you directed that we come back to you once a month to review how it's going with the policy. We continue to check in with department heads, and we're still receiving pretty good reports about how it is working. Most indicate that staff are able to be fairly productive with it. And most offices, I'm sure you're aware that most offices are doing a balance of in-person duty and remote duty and accommodating the public in the best way possible during the pandemic. So today it's basically a report. Department heads still give us good feedback about the use of this policy. We're not recommending any changes because department heads have not indicated a need for change. And when you approved it in June, you authorized it for the 90-day period ending September 20th. And so it's on track to continue with these monthly updates. So that is my report.
Okay, any questions from the board? Comments? Yes, Supervisor Sabatier.
Not a question, more of a comment. As you know, I was in support of doing this before we started for COVID-19, so I'm happy to hear that it's mostly working. I do want to say that I think we need to ensure that our productivity is still up, and if it's not, then that should definitely be a point of new conversation as to what is happening and what is going on. Obviously, that's within each department, but I will say that I am seeing a lot of activity on social media from those that are working from home, and I would hope that that is something our directors are paying attention to make sure that we're getting the full productivity of our employees as they are continuously being paid by public funds through taxes. And so just wanted to put that in the airwaves for our directors to hear. I just hope that we're looking and paying attention to that. Thank you.
Looks like we have a comment from one of our directors, Sheriff Martin.
Yeah, I'm glad to hear Supervisor Sabatier bring that up. That's a concern for me as well. And I can't speak for all department heads, but I will tell you for myself, it's probably hard to tell who's on duty with the sheriff's office at any given time, a large number of the staff. I would invite any of the supervisors, if they have concerns about activities of people that should be working from home and maybe not working and engaging in social media type of stuff, to bring it to the respective department head, and hopefully action can get taken. It's not reassuring when we see people out there that are posting things and knowing they're collecting a paycheck supposed to be working from home and clearly not. So I'd welcome any feedback if you observe any of my staff doing that, and I'll be happy to look into it.
Okay, thank you very much, Sheriff Martin. Any other comments from the board? Okay, we're going to go ahead and open it up to public comment on this issue. I don't see any hands up. Jake, can we open the room?
Yes, sorry, I will unmute the floor here. All right, the floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake. We can close it up, bring it back to the boardroom. Right. Anyone who would like to make comment on this item in the boardroom?
There is nobody left in the boardroom. We've run everybody away.
Okay. Well, we'll go ahead and bring it back to the board then. And I see Supervisor Scott. You had your hand up. Go ahead.
Yeah, I don't have any questions, but I really appreciate that we're continuing this because I know with schools opening up next month and there's so much unknown, just some people being able to have the ability to stay home with their kids. I'm really proud that we are looking into continuing this because for me as a parent, it's to be able to stay home and homeschool your children, having that choice. I'm glad that the county is continuing this.
Yeah, I think it's definitely a positive. And like I said, it's unknown between now and the end of the year what our working conditions are going to be, or even what they're going to be next week. So definitely a positive thing. And eventually, like we said, turning it into a continuous opportunity for folks might address some of our issues for creating new offices and other stuff. So, all right, thank you. I'll bring it back to the board. This was for information only, or we got an action to take on this one?
Supervisor Brown has his hand up.
Okay, sorry, Rob. Supervisor Brown?
Yeah, I wasn't going to say anything because it's just all over the map here. But I do want to say, after listening to Tina, I think it's appropriate to. There's a lot of different circumstances for a lot of different people. You have the people like she suggested, that have kids at home. You have, people who are either compromised themselves or immune compromised, or have somebody near them that are. But man, I'll tell you, we're going to talk about it here in a little bit too, but we've got some dedicated employees that show up here every day in face of all of the hype, and whether it be real or not, it's hyped up for sure, and amped up, and tension, and the public. And we have some really dedicated employees that have no other option but to show up for work, and they do it, and they don't complain about it. They take every precaution, and I really appreciate them as well. So I think we're lucky to have them.
Absolutely. Thank you, Supervisor Brown. Carol?
Yes, Mr. Chair. So you asked a moment ago, this is just a report. There's no recommendation for change, and we'll be back the second Tuesday in August to report again.
Perfect.
Okay. All right, we'll go ahead and complete that item then, and we'll move on to our item 7.6, consideration of A certification and receipt of funds pursuant to paragraphs 2 or 3 of subdivision D of control section 11.90 of the Budget Act of 2020 for the County of Lake, and B, certification, the receipt of funds pursuant to provision 3 of item 9210-110-0001 of the Budget Act of 2020. Carol, go ahead.
Thank you, Mr. Chair. So prior to the end of last week, I was tasked with signing 2 certification forms that I had to submit to the state. They were due on July 10th. And what I'm asking the board to do today, if you will, is ratify my submittal of these certification forms. All 58 counties were tasked with this. And the first form is for the receipt of Coronavirus CARES Act funds, I should say. And this is the topic that we were touching upon earlier. The CARES Act funds that have been allocated for Lake County total $6.59 million. Those are for all of the expenses and costs we've incurred to date, as well as additional expenses that we may incur. If you've reviewed the certification form, which is there in your agenda packet, it requires that our county adhere to all federal guidance and all of the governor's executive orders, everything the governor has ordered throughout all of this, as well as the California Department of Public Health. And then, of course, there are some stipulations about how you can use the funding and reporting requirements. We have a pretty substantial amount of expenses that have been incurred to date that we hope to charge to this. And basically, the direction we're getting is that these funds should be used instead of attempting to claim through FEMA. And as your board well knows, it's very complicated to get reimbursed from FEMA. And so we're grateful to have these funds made available to us. And also with FEMA funds, there's a significant county share of cost as well. So the first form for your consideration is the one under item A, and that is the CARES Act form. And so basically what I'm asking is for your board to ratify my submittal of this form.
Thank you, Carol. Okay, we'll go ahead and turn it over to questions for the board. Comments? Supervisor Brown?
So in the earlier discussion that we had, I'm just going to read a quote from the governor. The governor said he views the $2.5 billion fund in the budget that lawmakers are expected to approve this week, and that was in June, as not a punishment for local government, but a reward. So that was where that came from. He said it. I didn't invent it. I didn't imagine it. But it also says, and this is where I want to find out, says that $550 million, this is the total fund, is for local governments to house people who are homeless and at risk of losing their homes due to the corona pandemic. How much of that money that we're talking about is going to go towards that?
Well, that is yet to be determined. You may be talking about a different fund than the CARES Act fund. I'm not sure what information you have in front of you.
And that's what I said in the earlier discussion. You guys said no, it was the same funding, so I can't keep up.
I'm not familiar with that amount. You said you did 550 billion.
550 million goes to local governments through the entire state fund.
$150 million in federal funds allocated to the state of California? The breakdown is. It includes $550 million for local governments to house people who are homeless or at risk of losing their homes due to the coronavirus pandemic. Another $500 million is earmarked for cities and $1.3 billion for counties to be used towards homelessness, public health, public safety, and other services related to the pandemic. And so your question specifically is how much of this fund are we going to use for homelessness?
I guess I'm looking for the breakdown for all of it.
Well, we haven't determined that breakdown. We have a plan we're working on a plan, and I've been meeting with the auditor controller, who, as you know, handles our disaster finance and is the one that is tabulating all of our expenses to date. We do anticipate that our expenses will not meet that $6 million, and so your board will have some discretion in terms of how it is spent.
Okay, so that'll come back to us at some point?
Absolutely. You bet.
So in anticipation of that, it's not just homelessness, but it's people who are at risk of losing their homes due to the coronavirus pandemic. So I want to make sure that we emphasize that need and that we find some mechanism to reach out to those folks as well, because it's a real thing. If we can keep people from losing their homes, then we keep them from being homeless. So I think it accomplishes both things. So
yeah, the guidance on all of this is trickling out, and yesterday I spent most of my afternoon on a Zoom call, and there are 6 categories, 6 general categories. And let me just back up a little bit, because there are 2 overarching categories. Counties use these funds, the CARES Act funds, for the costs of their direct response to the disaster, and then they can also use these funds for second order effects, the kinds of things that you're talking about, other consequences that come from the disaster. And then underneath that, there are 6 categories: medical expenses, public health expenses, payroll costs for substantially dedicated essential employees, compliance with public health measures and mitigating impacts, economic support, and then there's a category called other. So as I said, we have a group that is putting together a plan, and I was going to confer with the chair soon and ask if he would assign a subcommittee of board members to work with us on that. But some of the things that I've heard talked about today and on many days that we probably need to focus the use of some of our funds, once we've clarified how much we need to pay our expenses to date, would be testing, technical assistance, enforcement, food, homelessness, possibly the cost of our unemployment to date, the cost of our essential worker leave, potential grants to small businesses, tenants facing eviction. You can even use this money to support citizens who have lost loved ones and need help with funeral expense. You can use it to address increases in your workers' compensation costs that have resulted from the disaster, and hazard pay for substantially dedicated employees. You can use it for audit expense. And one of the things that was stressed in the webinar I was in yesterday is that the state is not requiring that counties seek competitive bids if some of these services or resulting actions are contracted. And the reason for that is because there's such a tight timeline to spend it. These are for expenses occurred between March 1, 2020 and 12/30/2020. It's going to flow to us in such a way that the initial 1/6 payment will be coming to us soon, and then we'll get additional 1/6 amounts August and September. So that would obviously mean that by September we have about half of our money. I don't have final figures from Kathy Saderlin yet on our disaster costs to date, but I imagine that that half would be easily used by the disaster expenses to date. Then the state requires that we check in with them around October 1st. They're very firm on their direction that if we have funds unspent October 30th, that those funds will have to be returned. However, I believe it's my understanding that if we have some of it clearly encumbered by that time, meaning it's going to get paid out before December 30th, but it's clearly encumbered, we'll be able to retain those funds to pay our obligations. But we need to move very quickly on this in order to benefit from these funds.
Thank you, Carol. Supervisor Sabatier, yep.
Thank you very much. And I'm wondering if this is just kind of a trailer bill to the CARES Act, because $532 million is specifically for funding for housing and homelessness programs. So that might also be an attachment to the CARES Act. And also, I don't have the direct connection, but I'm wondering if that's what became the Project Home Key, which would be money to purchase houses, rehabilitate them, and at this point being available for low-income housing or homelessness, an upgrade of living situation. So that could be the situation for that. I'm curious as to, do we have any numbers from Kathy Saderlin as far as what we've already spent that could be reimbursed using these funds? Because I'm wondering.
We don't yet. We're regrouping on Friday.
Because I know that we've definitely, in my mind, I could probably think of close to about $2 million that we spent, and just kind of curious as to what would be left over. But I am aware also that in the larger areas where they directly received the CARES Act funds because they had a population of 500,000 or more, this was in a state meeting that I was in, that some of the larger counties are probably going to be giving some money back, because to make it directly linked to the criteria that has to be met in order to use these funds, that they're probably going to leave some money out on the table. And so I don't know how difficult it will be for smaller communities such as us, but I sure hope that we can utilize every penny that we can to the fullest.
Supervisor, they're definitely stressing that funds not used will be reallocated, so that is distinctly possible. And if you remember, I believe it was in May, our finance team came forward and reported to your board on our disaster expenses to date. As I recall, it was more in the neighborhood of $4 million. But again, that's a rough figure. We're working on nailing that down. So But yeah, we're pretty excited about the prospect of being able to utilize these funds, not only to keep the county whole for all the expenses we've incurred to date, but to do some very positive things in our communities.
Okay, any more comments or questions from the board? Supervisor Crandall, did you have something?
No.
Okay. Yeah, well, excited to have the opportunity, $6 million can make a big impact here in Lake County. And yeah, I know that like Supervisor Spatier said, the CARES Act does come with some pretty strict guidance that do need to be tied to COVID-19, responses and other things. But I think with the group that we have together here in county and county admin and finance, we've done a good job of tracking all those things, and they are all in response to COVID-19. So hoping that we're very successful in getting these monies spent all here in Lake County. And if there's an opportunity down the road where some others didn't, maybe we can get into that loop if that happens. But this is a very good, positive thing for Lake County. These funds are going to be very important in helping us address this between now and the end of the year. So go ahead and open it up to any public input or public comment on this item. Jake, can you open the room?
Yes, I will open up the room. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, hearing none, Jake, go ahead and bring it back.
All right.
And I know you made the comment earlier, no one's in the room. I'll still ask the question, is there anyone in the room that would like to make comment?
There is nobody in the room currently to make a comment.
Thank you. So we'll go ahead and bring it back to the board for action.
Mr. Chair, I had one more.
Go ahead. Go ahead. Did you have a comment or question?
Yes, I did.
Supervisor Crandall?
I thought about it after you already opened the public input, but it's to Carol. So with some of this funding, with the situations where we're getting directives from the state, would some of this funding be able to be utilized for some of those directives? So for example, if there's a directive that's given by the state and we don't have the resources to take care of it, would this funding be able to be utilized for that? Am I reading that correctly is really what I'm asking.
Absolutely. Okay. It's definitely intended for that sort of purpose. You bet.
Okay, excellent.
If nothing further, Mr. Chair, I move to approve certification for receipt of funds pursuant to paragraphs 2 or 3 of subdivision D of Control Section 11.90 of the Budget Act of 2020 for the County of Lake, and approve certification for receipt of funds pursuant to provision 3 of item 9210-110-0001 of the Budget Act of 2020.
Mr. Chair, I haven't presented number B there, and I think his motion included B.
Yeah, I guess
A and
we would
B
need
was both.
clarification from Anita. I think what he was trying to do was tying it all together. If we get clarification, we need to do an motion A.
I could present, if you'd like, I'll go ahead and present B.
So sorry.
Mr. Chair?
Yes.
You can do them both together, but you'd have to wait until they were both presented to you.
I'm so sorry.
All right.
Skipped ahead.
Thank you. Go ahead, Carol.
So this next one is probably a little simpler in that it is backfilling realignment funds that we rely on heavily in our social services, behavioral health, and law enforcement divisions. There are 2 rounds of funding for Lake County, and because there are 2 pots of funding. The first is a statewide pot of $750 million, of which Lake County will receive $2,075,819. And then there is a second wave. It's a total pot of $250 million. And this is contingent upon the feds actually approving it. So that isn't an absolute. The first figure is. But if the feds come through, Lake County would receive another almost $692,000. And this is to backfill the sales tax losses that have come about as a result of the pandemic. the programs that rely on those funds. I mean, it's, 3 of those departments are the ones we always refer to as our self-funded departments. But because of the dip in sales tax resulting from the pandemic, if those departments don't have sufficient realignment funding available, then they'd be looking to the general fund to support their costs. And there is no general fund money available to support those departments. So again, another very critical funding source for Lake County. On this one, on the certification form for this one, the criteria it has less detail, but basically it's the same requirement that we stay in compliance with all the governor's orders and the California Department of Health orders, and that we use the funding in accordance with what is essentially the way we already use it for those programs. So that's the second certification form.
Okay, and I apologize. We had the 2 certifications. I rolled them into one there. Okay, any comments from the board on B, the second certification form?
Nope.
Okay, seeing none, need to open that up for public comment. Go ahead and open it up for public comment. Jake, if you could open the room.
Yeah, I will open the room. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, hearing none, go ahead, Jake, close it up, and we'll bring it back to the board for action.
And just again, nobody is in this room for any comments, and since that's the case, I will make my motion again. And that is, Mr. Chair, move to approve the certification for receipt of funds pursuant to paragraphs 2 or 3 of subdivision D of control section 11.90 of the Budget Act of 2020 for the County of Lake, and move to approve certification for receipt of funds pursuant to provision 3 of item 9210-110-0001 of the Budget Act of 2020.
Second.
Second by Supervisor Crandall. Can we go and give a roll call vote, Johanna?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
I think the mic, I can't hear that mic for some reason.
No, I did have it off that time. You're probably wondering what I said, huh?
Yeah.
I said yes.
Supervisor Brown?
We couldn't hear your vote.
I said yes.
Okay, and Supervisor Simon?
Yes.
Thank you.
So, Mr. Chair, just a couple of additional notes. I wanted to ask Johanna if she could create a minute order for these 2 actions, just so we'll have it for our disaster finance records. And then I mentioned earlier that we were hoping to have a subcommittee that would work with staff in preparing the recommendations for your board on how all of this money be spent. And I wanted to ask if Supervisor Brown and Supervisor Sabatier would work with us on that.
I'm perfectly fine with an extra meeting. Are you okay with an extra meeting?
Yeah, Bruno's perfectly fine with that. I said Bruno's perfectly fine with that. Just let me.
All right, does somebody else want to jump in there then, or?
Just let me know. Just let me know.
Yeah, we're good.
Yeah.
Okay, thank you.
Okay.
Give us about a week or 10 days.
All right. Okay, moving back to our, up on the calendar, item 7.2. I'll go ahead and read the item here. 7.2, consideration of closing of the board of the supervisor chambers for in-person meetings at this point. I was the one who asked to put this, this item on the agenda. Obviously, I asked before what has happened from the governor's office and other things coming down the pipe, but the thought was behind the opportunity to be proactive instead of reactive as we move forward in this, and being over, the attendance we've had over the past few meetings and the way that, the coronavirus is escalating at this point. thought it might be prudent to have a conversation on closing the chambers at this point and then reevaluating it on a potential of a 30-day basis. And I know it's always controversial when we talk about these things, but I thought the timing was right, and obviously, it's a good time for the conversation. So presented it as is, and what I would like to do, obviously, is get the feeling of the board, put it on there, and so we could have a good discussion and give an opportunity for all of us to weigh in on it. So go ahead and go, Supervisor Sabatier.
Thank you very much for the opportunity to speak on this. I will say that while I know which direction I would like to go, what I would like to share is it's either an all or nothing. If we feel unsafe in this boardroom, which today we had 5 people here, last week we had about 6, maybe 7 people here listening into the Maha project, and maybe they'll be back next week. We have not seen a large crowd. We're still seeing a good crowd online. And I think that we have to recognize that some people don't have the access to be able to watch it online, and I think it benefits us to make sure that we are as transparent to the public as possible, and including those that don't have online access or capabilities to have online access. But my other personal feelings is, if it's not safe for us, it's not safe for our employees. And if we're asking our employees to come here and to do the work to serve the community, then I think that we need to be side by side here with them to show them that we consider it to be safe for them to be here. For us to have this discussion to say that we should not continue in-person meetings, then we need to go all the way and say, well, then nobody should be here at all. And I don't think that's the case, that we need to go that far. So I would like to continue as we've been doing. I don't mind the hybrid. I think that today has actually worked a whole lot better than previous meetings. The sound turned on right away. We didn't have to take a break to fix the technology. And as long as it keeps going that way, I think that we should continue this way. I don't anticipate, we've all seen the board meetings in the past. The only times we pack it is when something truly controversial like cannabis shows up, and even as of late, that has not crowded the courtroom or the boardroom for us. And so I think that we need to continue as is. We need to make sure that we get as high level of a compliance for masking and for social distancing as we can, but that if we want to continue to operate and serve our community, that our staff needs to be here, which means that leadership needs to be here. And when I say leadership, I mean all of leadership, because we can't ask people to do work that we're not willing to do.
Well, if I can respond to that respectfully, I brought it up today because we had a conversation today earlier about a public health order. And it is definitely, we've proven that we can have these meetings without having the boardroom open at this point. I support, we have pushed, and I have pushed, obviously, from day one about masking, social distancing, being in line with what CDC and the other folks were talking about for safety of the issues of our community. And, I bring it up today. Each individual has to make their decisions. Obviously, what you're doing or what's going on with your family should drive those. And I think giving our employees those opportunities about remote working and other things, we need to continue down those roads. As far as the boardroom, what we don't control is where the folks that come into the boardroom have been, or where, what they've been doing, who they've been in contact with. We talked about it earlier. Most of these things are folks and families that may not, be adhering to these things, and just talked about the safety of being in the boardroom for 4 or 5 hours with individuals that you yourself or others don't know who they are or where they've been. And bringing that into the courtroom. We've seen it throughout the country, even throughout our state. Our own assembly, at the state of California has now suspended for some time because they've got a positive case that came in there. Trying to be proactive, but once again, is the conversation. It's about supporting our employees while working remotely. And, this board pushed hard in the past to get the things back open and to get it back open as soon as possible. And now we're moving in a direction that may be going in a different way. We may have pushed too hard to open up too early. And whether or not we want to admit that, I don't know. But I think just being proactive is the way to do it. We may not do it now. I bring it up now because I think it's the conversation to have, but it may be out of our control in 3 to 4 weeks or even 6 weeks. It may not. I could be wrong, but it hasn't been going down or lessening anywhere in the country or especially in our county. Supervisor Brown.
So I disagree with, or I'll separate a little bit from Bruno's comments about, if we're going to expect everybody else here, then we should all be here, the leadership be here. I think people should do whatever they feel comfortable with. I think we should leave this as an option. If we want to be here, fine. If we're doing it today, we're not having any problems. And I got to tell you, this whole thing with the assembly, one person tested, they didn't get it at the assembly. There's no indication that they got it there. Just because they closed down, I mean, so we can't imply that. We can't imply that somebody would get it here. This place is pretty safe. We got all this gear around us. Nothing is 100%. I know there's some people that are be criticized for not wearing a mask, and it's nobody's business why I can't wear one. So that's left to me. I'm not putting anybody at risk here. I don't feel at risk myself. I stay away from people during the day. I don't come in contact with anyone, and I feel safe here. There's 19 or 20, 25 maybe opportunity here. And I was at court this morning, and I had I witnessed there's 32. There's an occupancy of 32 up there with staff, and many of them are our staff. That have to be there. So to say that, we have opportunities for our employees to either stay home, not all of our employees have that opportunity. Some of them have to be at work, and we have to make sure that they're safe. So we're fortunate. We're exposed for, you say 5 hours a day, usually it's only 3 to the route to the building, not to people. These people, the people that we're expecting them to be here 8 hours a day, 5 days a week. And so, we have 1 day a week, 3 or 4 hours a day, and it's pretty safe here. Anyway, and back to my point up at the courthouse, or up on the 4th floor. They're not closing down. They're making it work. They've got jury selections that have started. The case was settled last week, so they didn't have one, but they'll have one probably tomorrow. There could be up to 150 people. They figure out how to make it work, how they do it up there. The bailiff meets them at the door. Do you have a case on? If you don't, you're not coming in. If you have a case that's going to be farther down the line, they'll let you know. You can be out in the hallway. Nobody has to be there. We can do the same thing here. If we anticipate an item that's going to have a lot of people, we can arrange to have somebody at the door and say, hey, just come in whenever that particular item's on the agenda. We'll make arrangements. I think we should keep this open as an option. Here's the other thing, and this isn't a criticism. This is just the time of year that we're at. We have PSPS coming up. We're going to have people that are shut down. We're still going to be operating. This may not be an option for people, may not be an option for us. So I think we need to keep this open as an option instead of just a brush stroke of shut it down and we'll keep going back to Zoom. I don't feel like we need to. I still, I respect anybody that feels uncomfortable. Their situation with their family members themselves, for that matter, that need to stay at home and still operate in this manner. I'm good with it. However people want to operate to keep themselves and their family and the public safe, I'm good with any opportunities that are available, options that are available to them. And so I think we should just keep that open, do exactly what we're doing today. I don't see a problem with that. I'd rather do that than to shut down completely.
Thank you very much, Supervisor Brown. Supervisor Scott?
I appreciate this conversation, and I have to agree. I think this is working for those who, go in and those who stay on Zoom. I am really excited at all the participation we are finding from our public on Zoom. So even when we go back to normal or find normal, I would like to continue being able to give this option to our public. For me, when I went into the boardroom, I found it was difficult for me to be in there and watch a screen across the room. So I find it's easier for me to sit at home and have the capabilities of having my computer screen on. I know that they said if we have too many people with, too many devices on there, there would be a problem with the technology part. So, I appreciate this conversation, but I think this is working for now, and, to continue monitoring this and see what works best for all of us.
Okay.
Well, for me, you all have the opportunity because I've been conditioned to just follow orders. I've been in the military, so either way, I'm good with it. It would help at times for me to be able to conduct Zoom. I don't get to see my wife because I'm not susceptible. She's susceptible. So we stay in different homes and stay away because I'm out, and it's not just this, that I'm in the public. So, but I'm good with either way. I do understand that there's people that work every day and are here, and then there's some that don't. They have the opportunity to be able to work from home, and I'm glad that we're able to offer that. And I hope that we can get to a point where everybody has a common, I guess you could say, a courtesy or a respect for one another with the choice that they make. And I'm glad to hear that we're having that right now. I just hope that it integrates into all of the departments, that work under the counties, under the county, So yeah, I'm good either way, to be honest. And if I can do either or, I don't mind doing it. So, yeah.
Mocha, if I could too, I just want to, because the public, I don't know what the public can actually see out there. I don't know, how, if they look at it. But, Eddie and I, as you can see, we're 2 feet apart. There's a 1/4 inch of glass between us here. You guys know that, but the public doesn't know that. Eddie has a mask on. We talked about it earlier. He offered to sit down there. I offered to sit down there. We're good. It's not a risky situation, I don't feel. And so, I just, there's a lot of things going on right now.
Yeah, and I appreciate everything that is going on, and I know, some of the stuff I put on there, it's very controversial stuff, but I think they're the conversations we need to have. I respect everybody's viewpoint. I thought on bringing this forward was, we have a pandemic, we have a public health order, folks who are over 65 should be sheltering in place. Obviously, they can make their own decisions. But I know that some of the folks that we've had sitting in that room are over the age, should be sheltering in place, and us trying to encourage to follow the orders as closely as possible, is always a thing. Messaging and our leadership is always looked at on what we're doing. So I bring it up. I understand everybody's point of view. I'm going to turn it into a situation of, someone being scared or making decisions. That's not what it's about. It's about just really looking at the community's public health, and also anything that's coming into the building that we have control of. Not the courts, that we're always looking to have these conversations. So I do appreciate it. I respect each and every one of you. And this is an item that I wanted to bring to the board. And, people from the public, I think, will have some comment on it. But I appreciate the conversation we're having today. And I clearly see the direction it is going. So, Supervisor Sabatier.
Sorry, I had to run out of the room. There's a fire right next to my house, but it looks like it's being contained. I did want to clarify.
That must be frightening.
What was that?
That must be frightening to have that happen to you.
It can be, yes. Especially since there's no one at my house except for my dog. So
I wouldn't know.
Yes, you're right. Sorry, missed that one. I'm a little slow right now. I did want to clarify my statement. My statement was more of, if we cancel our meetings, the message that we would be sending to our staff, rather than we have to be here. No, it should still be a choice of what makes you more comfortable. So just kind of backing out on a little bit of what I said, I misspoke. What I'm saying is to look at this as being canceled while still asking our staff to be here, I think would be a contradiction. So just wanted to clarify.
And I guess to clarify, when I was talking about closing the boardroom, that would be to the public coming in. If board members want to go sit in the board and we do the thing as Zoom, that was what I was envisioning, is if a board member wants to go sit in there. But it was more of letting the public in and controlling that aspect of having individuals actually live bodies in the boardroom. So, I appreciate the conversation, all the way across, I think, obviously I see the direction it's going, but I thought it was a conversation we need to have. I really appreciate it. I'll say right now, on anything that's controversial, yeah, there are a lot of emotions. Supervisor Brown hit on it at this time. We've got to come together and just continue down the road of having cordial conversations and moving in the right direction, to hopefully make the right decisions for everyone in this county. So I appreciate it. And if there's no more comment, I'll go ahead and open it up to public comment. Does anyone else have a comment? Okay, we'll go ahead and open it up to, open it up to public comment. I don't know if staff that's online has any comments. I see that Michael Green is too, but if anyone would like to speak up, go ahead, and we'll start with Michael Green. Go ahead, Jake.
All right, I got you unmuted here. Give me a sound check.
Yeah, got it.
All right.
This is just very unfortunate. The idea that we all have to make our own choices about feeling comfortable coming into the chambers or not, with your sneeze guards and half you masked up and half not, it's terrible messaging. I'm glad you have sneeze guards between EJ and Supervisor Brown, but by my view, you're not compliant with the face mask protocols. So you're basically broadcasting your non-compliance with the state orders for 3 hours at a time, while conceivably putting yourselves at risk in doing so. We already had a proclamation last week, didn't have masks in there, proclamation this week. So if it's going to be mask optional, just advertise it as such. Tear down the sneeze guards. If you feel comfortable, come on, great. If you don't, get on out of there. But that's really not the way the public health order is supposed to work. You're supposed to provide a safe meeting space and enforce social distancing, and you can't even enforce social distancing on the dais. So the idea that you have to bend over backwards and have this hybrid meeting room so that people can come in and do their own mask optional interpretation of this, it is, among other things, terrible messaging to the public, but also to your employees. So, if you can't wear a mask, Mr. Brown, that's great. You should be the one out of the dais, and we shouldn't be putting sneeze guards up and around to accommodate your refusal to wear a mask. And so, by my take, what I've seen for the last 3 hours, good, but is it fully compliant with the state order? No. And you might want to think about continued efforts to not wear those masks during your hybrid meeting.
Actually, it's 100% compliant. Your ignorance doesn't surprise me, though.
Michael, thank you very much for your comments, and we'll move on to the next. That was the only hand that I saw up. Jake, is there anyone else?
That looks like the only hand that was raised. Yes.
Okay, if anyone else in the room would like to make a comment, please do it now. Okay, Jake.
I unmuted the floor here.
Yeah.
I didn't see any additional mics toggle.
Okay, Jake, go ahead and close it up and bring it back to the board.
Okay.
Obviously, I brought this to the board for the conversation today. Didn't go anywhere, but I brought it under the, aspect of really trying to, set that example in making the community as safe as possible. And it's clear to hear from the board, that we're going to move forward in this manner at this time. And, a motion at this point would be, just like the unfortunate one, really not worth having because we know where it's going to be. So, I was hoping to be proactive on it, and that's why I brought it to the board. So we'll go ahead and bring it back. I don't know if anyone else wanted to make a motion or something. I know I'm not going to give up the gavel to do that. Okay. Seeing none, we'll go ahead and move on. We've closed out our regular agenda items on our 714 agenda. And now we have closed session. We have 2 items. We have item 8.1 with legal counsel and existing litigation pursuant to Government Code Section 54956.9D1 FERC project, number 77 Potter Valley Hydroelectric Project, and 8.2, conference with legal counsel, significant exposure to litigation pursuant to government code section 54956.9, D2, E1, one potential case. And with that, we'll go ahead and close the meeting, and we'll see you guys in closed session in just a few minutes. Thank you, everyone, who participated.
If board members would just stick around, we'll do closed session right here after the room clears. We'll secure it, and
okay.
So we can take a minute break or something while it's clearing.
Okay, we'll see everybody in about 5 minutes.